Ladies and gentlemen, I have a great pleasure to welcome you here in this place. This is a very important event. Today, the word trust will be repeated in very many contexts. The trust in the context of immunization, trusting vaccinations. Well, this trust seemed to be going down in Poland recently. Many people more consciously or unconsciously avoid vaccinations. One of the reasons is lack of information or disinformation. And that's what we're going to address today. What can we do to build information in a way so that it is credible and in a way that it reaches as many people as possible? What to do to convince those who have doubts and need to take a decision whether to vaccinate their child or not? What can we do to reach the patients with information that is credible, clear, and builds trust to vaccinations? Ladies and gentlemen, welcome to the conference Trust Vaccinations, and it is held under the Immunization Week. We had an educational picnic and a run yesterday, and today we have a conference held at the Institute for Mother and Child, organized with Foundation for Institute of Mother and Child, together with the World Health Organization office in Poland, as well as the Office for Refugee Activities in Poland. We cooperate with the Minister of Sport on this event as well. Welcome, Tomasz Maciejewski, Director of the Mother and Child Institute, to open the conference. Good morning, ladies and gentlemen, in the Institute of Mother and Child. In the scientific conference, Trust Vaccinations, organized under the European Vaccination Week. Welcome, Nona Zaherman, Country Coordinator of the UNICEF Refugee Response Office in Poland. And our special guest. I want to thank the Minister Izabela Leszczyna and the Nowacka for their participation in the picnic and run at the National Stadium. It has been a challenge, but also I think it was really interesting and successful. I want to thank the organizers of this meeting, Deputy Chair of the committee for the whole program of the conference, and Dorota Klaszczewska, President of the Board of the Foundation. And thank you. I give the floor for the further proceedings. Thank you very much for coming, so many dear guests. I can see representatives of the clinical teams at the Institute. I want to welcome everyone who's online with us, because we are online today. On the side of the foundation, I want to thank the partners from the UNICEF and WHO, because we have been working intensively the immunization work. Yesterday we had a day full of events and activities despite challenging weather. People had smiles on their faces, which was a good success. At the foundation, we understand our place in the following way. We promote scientific research and reliable information that is evidence-based and fact-based. On the other hand, the information needs to be friendly, attractive, and accessible. It needs also to be in places where mothers and children are, and they can use it. That is our role, the way we perceive it. The Institute for Mother and Child, as founder, patron, and scientific base, and the clinical base, of course, is one aspect. And on the other hand, we have experienced institutions who know how to operate under the migration crisis. We had a privilege to participate in trainings in Istanbul when we talked to experts from various organizations in New York University, Radcliffe University, people who are much more used to a situation when they have people entering country, and we have people who are from other countries and they come to our kindergarten, schools, works, and have different level of immunization. We need to act together so that they can trust us, trust our healthcare system, trust our doctors, and trust vaccinations. And that is why we have such days as yesterday and today, and a cooperation that I hope will be equally effective. Thank you very much. I invite Nona Ziherman, country coordinator of the UNICEF Refugee Response Office in Poland, to take the floor.
Wobec wszystkich pracowników służb zdrowia, którzy niestrudzenie pracują na rzecz szczepień. Jesteśmy też wdzięczni rodzicom, którzy z biurem UNICEF oraz IMIT, Fundacją IMIT. Były tutaj też przedstawiciele Uniwersytetu Yale oraz
through interventions supported by UNICEF under the leadership of the Ministry of Health and in partnership with the Department for International Cooperation. Resilient primary healthcare systems are essential for risk mitigation and response to emergencies, whether it's pandemics or population movements. The UNICEF Refugee Response Office in Poland plans to continue providing technical support to promote the uptake of vaccination among the most vulnerable populations in Poland, with a focus on refugees, Roma, and other groups. In closing, I extend my heartfelt appreciation to the Ministry of Health of Poland, the Institute of Mother and Child Foundation, and WHO for their unwavering collaboration and partnership with UNICEF. Building on past successes, we invite you to continue the joint efforts to advocate and mobilize everyone for the vital cause of childhood vaccinations. By ensuring all children are fully vaccinated, we are not just protecting them from preventable diseases, we are empowering them to lead healthy lives and reach their fullest potential. Thank you.
Zapraszam pana doktora Marka Muscata
I
z Biura
invite
Regionalnego
Dr. Mark
Światowej Organizacji
Muscat
Zdrowia w Kopenhadze.
from the office in
Dziękuję bardzo.
Copenhagen.
Hello, good morning. Dzień dobry, of course. Yeah. I work for the WHO European Office in Copenhagen on vaccines, particularly on measles and rubella. And it's a pleasure to be here in Poland. I have been here in Poland many times, working with colleagues from PZH and from GIS, particularly. It's a pleasure, particularly today, for being here celebrating immunizations. Indeed, we have to celebrate immunizations and the benefits that they bring with them, because many lives are saved through immunization. And when we start becoming complacent, we start taking things for granted, and vaccination coverage starts dropping, this is where the problems start coming up. We start seeing measles again, we start seeing pertussis coming up again, and other vaccine-preventable diseases. I thank you very much for coming here, for your interest in the topic of vaccinations, and I wish you a very successful day. Thank you.
A ja chcę państwa teraz zaprosić na
I would like to invite
fascynującą
you now
część naszego
to a
spotkania
fascinating part of our meeting.
dotyczącą prezentacji
Addresses
znakomitych
of the
gości naszych,
presentations,
w których będzie mowa o tym, w
wonderful
ogóle,
guests that
dlaczego
we
potrzebne są nam
host.
szczepienia, jak zmieniły
They will tell
krajobraz
us about
medyczny,
why we
jak
need
zmieniły
vaccinations,
krajobraz
how
medycyny,
vaccinations
nie
change the
tylko w
landscape
Polsce.
of medicine, not only in
Jak w
Poland.
Polsce są szczepienia postrzegane i
How
co można zrobić,
vaccinations are
żeby
perceived in
zmienić
Poland
to
and what can we
postrzeganie,
do
to postrzeganie
to
szczepień.
change this
Na
perception
początek
of
zapraszam
vaccines.
panią profesor Iwonę
To start with,
Paradowską-Stankiewicz, krajowego
invite
konsultanta w dziedzinie
Dr.
epidemiologii, z
Paradowska-Stankiewicz,
ciekawym
National Consultant for
wykładem,
Epidemiology,
możemy powiedzieć, krótkim
with a
wykładem
brief
dotyczącym
lecture.
tego, czy grożą nam
Are we
epidemie
threatened by epidemics?
i jaki jest w tej chwili,
And
jaka jest
what
sytuacja
is
w Polsce,
actually the
jeśli
state
chodzi o
of
stan
things,
zaszczepienia Polaków?
to what extent Polish people are vaccinated?
Serdecznie dziękuję za
Thank you very
wprowadzenie.
much for
Szanowni
the
Państwo,
introduction.
witam
Ladies
Państwa
and
bardzo
gentlemen,
serdecznie.
welcome.
To
Warm
ogromny
greetings.
zaszczyt dla mnie
It is an honor for
rozpocząć tę wspaniałą
to
dzisiejszą
open this
konferencję, choć
wonderful
temat, który
conference.
Państwu chcę
Although the topic
przedstawić,
that I
niestety
would like
nie
to
jest w
present to
pełni
you is not fully
optymistyczny.
optimistic.
Dlaczego? Dlatego, że
Why?
zajmiemy się
It is
dzisiaj
because
kwestią tego,
we
czy
are
w
going
naszym
to
kraju
address the
mogą
matter
pojawić
of
się
a
epidemie.
risk. Can we have epidemics in our
Właściwie
country?
na to pytanie można
This
odpowiedzieć
question can be answered
bez żadnego śledzenia literatury,
without
że
actually
jak
reaching to
najbardziej
literature
epidemie są
saying yes,
wpisane
because
w
the
życie
epidemics
każdej
are
populacji, każdego
just
społeczeństwa.
inscribed in
A
the lives
cytując
of
szefa
societies and
Światowej
countries,
Organizacji
to quote the
Zdrowia, pana
director
Tedrosa
of the
Ghebreyesusa,
World
można powiedzieć,
Health Organization,
że
Tedros Ghebreyesus, we might say that
jesteśmy przed kolejną pandemią. Czyli
another
pytanie nie
pandemic is
jest,
ahead of
czy
us.
grożą nam
The question is not
pandemie,
whether
epidemie,
pandemics or
tylko raczej
epidemics
pytanie powinno być postawione,
are a threat,
kiedy będzie,
question
kiedy
should rather be
przyjdzie
when
następna
a next pandemic
epidemia.
or
Tego
epidemic
oczywiście nie wiemy,
will
natomiast
We don't know
kluczową
that.
kwestią jest to, by się do niej
Still,
czy do nich
to be
przygotować.
prepared
W tej
for
chwili mówi
the
się o tak zwanej
pandemic, it is
chorobie
of key
X.
importance.
Nie wiemy, co to będzie za
We
choroba,
have been
ale już
speaking
świadomość
of the
tego, że
disease
ona w
X.
którymś
We don't know
momencie
what
się
it will
pojawi,
be, but we are
jest
aware
znacząca
that
właśnie
it
ze
will
względu
happen
na
at
to,
some
by
point.
w odpowiedni sposób
is
się
Important
przygotować.
therefore to get prepared.
Na początek jeszcze chciałabym Państwu
To start
zwrócić
with,
uwagę.
I would like to pay your
Mam
attention
doniosły głos, więc myślę, że
to
Państwo
a
mnie
following
słyszą.
thing. I hope you can hear me well.
Mianowicie krótko przedstawię
will
informację, kiedy mówimy o
present to
epidemii,
you
bo
brief
wszyscy
overview
raczej
of when we speak
mamy
of
świadomość
epidemic.
tego, że epidemia kojarzy
We
nam się
are
choćby na bazie
mostly
doświadczeń
convinced
z
on the basis of
SARS-CoV-2
the
z pojawieniem
SARS-CoV-2
się bardzo dużej liczby
that
zachorowań,
when lot
ciężkim
of
przebiegiem,
people
średnim
fall sick
przebiegiem,
with,
ze zgonami.
severe or
Natomiast w
moderate course of the
epidemiologii
disease
mówimy
and there
o
are
tym, że
deaths,
to jest duża liczba
that
zachorowań,
these are facts,
która
but in terms
przekracza
of
dotychczas
epidemiology,
obserwowaną
epidemic is when we
liczbę
have a large
przez
number
lata.
of
Czyli tutaj
incidences
Państwu
that
wskazuje
significantly
również na to, jak
exceed
bardzo ważny jest
the number
monitoring
of
sytuacji epidemiologicznej w zakresie różnych
incidences
chorób.
that were
No i
observed
takim
before.
przykładem jest co
To give you an
sezon
example,
występujący wzrost
we have
epidemiczny
seasonal
infekcji
flu
grypopodobnych oraz grypy. Mówimy obecnie o tak zwanej
flu-like
tridemii.
diseases. We have a
W
tridemia.
dotychczasowych meldunkach
So
epidemiologicznych,
far in
które
the
znajdują się na
epidemiologic,
stronach Państwowego Zakładu
reports
Higieny,
that are
mówimy
published
o
at the
tak zwanych
website of the National
influenza-like
Institute for
illness, czyli tych
Hygiene.
wszystkich
We
chorobach,
speak of
które
influenza-like
objawiają się
illnesses.
ostrymi
The
infekcjami
ones
górnych
that
dróg
have
oddechowych,
symptoms in the
a
upper
wśród tego
respiratory
dużego worka
tract
chorób,
severe
który
infections.
który
Among
się
the
znajduje, oczywiście
vast pool of
szukamy
those diseases,
grypy, szukamy
look for
SARS-CoV-2,
influenza,
szukamy RSV. I w jaki
SARS-CoV-2
sposób
and RSV.
właśnie w taki,
How do we do
jak
that?
pewnie
Well, the way
wielokrotnie
we
już
do it
Państwo
is,
słyszeli,
I'm sure
po
you've
prostu
heard about it
potrzebujemy
many times,
wykonać
we
badania
need
laboratoryjne
to make microbiological lab tests that confirm
spowodowane określonym
that
etiologicznym.
a given etiological factor caused the disease.
Epidemia to tak, że
Epidemic
zachorowanie choćby na
is when
jednej osoby,
at least one
która,
person
zostanie
falls
zakażona
ill
całkiem nową
with an
chorobą,
entirely new disease,
wirusem,
a
bakterią,
virus, a
całkiem
bacteria,
nowym patogenem,
a
który
pathogen
do
that
tej
is
pory
entirely new and
w badanym obszarze nie występował.
hasn't been
Czyli
present
tutaj możemy
in
sięgnąć do
particular
2019 roku i
area.
pojawienia się całkiem
Well, in
nowej
2019,
odmiany wirusa
we had an
SARS-CoV-2
entirely new
COVID-19.
version of
Wreszcie,
SARS-CoV,
proszę
which was
Państwa, o
COVID-19.
epidemii mówimy wtedy,
And
kiedy
we speak of
pojawi
an
się choćby
epidemic
jedno
when
zachorowanie
at least one
na
person
taką
falls
chorobę,
sick
która
with a
przez
disease
wiele lat
that
w danym obszarze nie występowała.
hasn't been present
No i tutaj
in the
podaję
given area
Państwu
for many
przykład
years. Let me give you an
choroby
example
takiej jak
of
błonica.
diphtheria.
Bo błonicą w naszym
Diphtheria
kraju mieliśmy,
in our country
do czynienia ostatnio w
was
2001
present
roku,
lastly, the
kiedy
last time it was in
został
2001
przywleczony jeden
when there was one
przypadek
single
dzięki,
case
dobremu
thanks to a
funkcjonowaniu
good
nadzoru Straży Granicznej
surveillance
został
by the
wychwycony
border
i ta
guards, it was
choroba
detected
nie
and that disease
rozprzestrzeniała
did
się
not
w naszym
spread
kraju.
in
Gdyby
our
miała
country at that
mniejsze
time.
szanse, ponieważ
It would
stan
have
zaszczepienia przeciw
low
błonicy w
risk
naszej
because
populacji jest dosyć
the vaccination
wysoki.
status and coverage
Proszę
against
Państwa,
diphtheria is
wracając
relatively
do
high
pytania,
in
które
our
znalazło
society.
się w tytule
Now, the
naszego
question that is in the title
dzisiejszego,
of
mojego
today's
dzisiejszego wystąpienia
speech
można
that I
powiedzieć,
have,
że
let's
jak
flip it
najbardziej
around.
grożą nam
We
różne
might say that we are at a threat of various epidemics, and with regards to that, what is of key importance is prevention. What we can do, ladies and gentlemen, is to maintain or actually improve the vaccination level, the coverage level against diseases that can be actually prevented using vaccinations. High rate of vaccinated people is one of the factors that bear the highest importance, and we should fight for it. We should take care of it. Now, ladies and gentlemen, I would like to show you briefly what is the compliance in vaccinating children and youth. The data is verified for 2022. The data for 2023 is not available yet. Maybe in 4 weeks it will be, probably. Then we will be able to see the situation for 2023. On the basis of the presented data, we can see that nearly 84% is represented by children and young people up to the age of 19, but they are evaluated at the age of 3, where the majority of vaccinations that is under the obligatory vaccination scheme is done. So at the age of 3, we speak of cohorts that are on the basis of data from a particular group of children in a particular year. 15% represents people who are partially vaccinated. They started a cycle of vaccination, for instance, with vaccinations that have several doses, but due to too young age, they haven't come to a full cycle. A percentage that you can see, 1.6%, is of children who are not vaccinated at all.
When we look at certain trends, please notice that from left up to right, we have a tendency concerning the state of immunization, state of vaccination, showing that this number drops. Even before pandemics, we had 85% of children and young adults who were fully vaccinated. But in 2022, we have 2 percentage points drop. Similarly, we can see that in 2011, we had over 1% of people who were not vaccinated at all, and in 2022, we had 1.6% of such people. Now, in short, a few diseases from the perspective of the last 20 years. We have diphtheria, tetanus, and pertussis, DTP vaccine. It is evaluated in the second year of life. And please notice that for a long time we had around 98-99% of vaccinated children, and it was very satisfactory, and we thought it was a constant situation, unwavering situation. However, recently we can notice a drop in 2017-18. We can see that population's trust in this vaccine dropped a little bit, around 4 percentage points. It is a significant drop. In 2021-22, this tendency notices a certain change in trend. However, we will see what 2023 brings. Then we have poliomyelitis, which is absent in our country for a long time. Why? Because we have the vaccination program, and we can see the percentage share, 99% of vaccination recently has dropped decidedly up to 94%. We noticed this drop since around 5 years. It is around 4 percentage points. The vaccination against polio has always been well tolerated in our country. We have never noticed any refusals concerning polio.
No proszę Państwa, odra. No,
And
choroba,
now
o
measles.
której bardzo dużo mówimy. Tutaj
Measles
z
is
panem
a
doktorem
disease
Markiem
that
Muscatem
is in the
pracujemy
center of many discussions
nad
right now.
poprawą
Together with Dr.
sytuacji
Muscat,
w
we are
naszym
working
kraju,
on
jeśli
improving the
chodzi właśnie
situation in our
między innymi o
country,
stany
especially in terms
I
of
też
the level
odra
of
oceniona w
immunization.
trzecim roku życia.
Measles is
Zobaczcie
evaluated in the
Państwo,
third
że
year
też,
of
no,
life,
tutaj
and
ten
please
spadek, ta
notice the
tendencja
drop
spadkowa
of
jest
the
jeszcze bardziej
tendency
wyrażona
for
w
vaccinations. It
porównaniu
is
z
even
wcześniej
more
przedstawionymi
pronounced compared
chorobami.
to
Ten odsetek
previously
jest w tej
presented
chwili w skali
diseases.
kraju
Right now,
sięga
at
90,
the scale of our country, we have around 90 or 90.9% of vaccinated population in 2022. Consequently, this situation is very disquieting. We can see the results of this drop of vaccination. During last 2 or 3 months since the beginning of the year, we notice outbreaks of measles epidemics in Poland, and we know that in many hospitals in Warsaw, and I don't know if in your cities as well, there are children that are being hospitalized due to measles, but not because they became not because they got measles, but because of the consequences, the complications, for example, pneumonia. Right now we have 7 outbreaks around big cities in Poznań, Wrocław, Warszawa. There are some smaller outbreaks, over 90 cases of measles reported in our country. The first case that was noticed was the measles that was imported into our country from Germany by a Roma citizen who came to Poland to visit his family. And he visited lots of relatives, and many people got infected in various towns in Poland. I want to show you how important vaccination against measles is. Right now, even among the staff working in hospitals, we have cases of measles. There was a paramedic who was transporting a child with measles and pneumonia to hospital, and he became infected with measles. Are we surprised? We are surprised that this paramedic was not vaccinated. We know that 2 doses of vaccination against measles proved to be the most effective against measles. However, this person, what do we know about him? We don't know if he was vaccinated at all. We can expect that he wasn't. And he got infected with measles, and right now he is undergoing this disease. We can see that not only children should take doses of this vaccination, but also those that are within the risk groups. This is the medical staff and people who are in touch with children, which means staff of kindergartens, schools and nurseries. I believe that it is worthwhile to verify your status of vaccination against measles, and if it is not up to date, it's worth to get vaccinated. Next disease, hepatitis type B. This situation is stable, especially because in mid-90s we introduced obligatory vaccination against hepatitis type B, and it is being continued in this schemata 1.6. And in recent years we have witnessed a small drop of around 2% in vaccinations against this disease. But we still know that here we witness spectacular success of vaccination. And why? Because right now we have only 6 up to 8 cases of acute hepatitis type B yearly. Why? because we systematically have realized the vaccination calendar and vaccinations against hepatitis type B, and we should carry on. Now TB, tuberculosis. We have certain fluctuations here, as you can see, and please note that this line shows the level of vaccination of newborns, so this is 92%. If we were to evaluate the situation of children in the second year of life, we can see that we have 97.7% of children vaccinated. Here you can see a comparison of certain diseases, including pertussis, diphtheria, measles, and we can see a certain tendency since around 2015-2016. This is a tendency of drop in vaccination. However, in 2022, we can see that this tendency stopped, it was halted, and maybe vaccinations numbers will increase. At least we hope so. And now we can see the tendency of vaccination and information that we managed to maintain, keep high share of vaccination against influenza. Here we have around 94-95% of influenza type B, then streptococcus pneumonia in the second year of life, and the state of vaccination. This is the blue column. It is at a very high level. We do not notice large drop we observed in case of previous diseases. Rotavirus, we know that for some years we have vaccination according to the calendar. It's around 87% and it's increasing. In the end, I'd like to show you the things that we monitor in PZH, which is the number of refusals concerning vaccinations. When we see first years of this graph since 2003 up to 2010, the situation was very good. And we noticed that around 3,000 people refused vaccination yearly. However, we noticed a negative trend, negative for us, which was launched around 2012-2013. It was very gradual in the beginning. However, the dynamics accelerated in 2016-2022. I can share my data from 2023 right now. The number of refusals concerning vaccination is nearly 90,000. It is a dramatic increase and dramatic number, especially when we compare it to 2003, especially when we compare it to years before 2003. So we have tens of thousands of refusals year by year. When we're observing this situation, the increase of refusals, drop in vaccination state in our population, when we observe that, we have the question, can we feel safe in this country? I will leave it without comments. To sum up, I'd like to say that the immunization status that I have presented here concerns the state of our country in general, and it is still maintained above 90%. But the situation is dangerous because at the level of powiat, at the regional level, we can see that the situation requires rapid improvement because we have reached this very dangerous level of 85-89%. This is the level which secures immunization of the whole population. And in many locations, we do not have it in reference to single diseases. The number of people refusing diseases increases. This is another factor. What can we do? We can deliver awareness increasing campaigns, educational campaigns, both for hospital personnel and healthcare personnel and various populational groups. This is our most important task for us. And the European Immunization Week is working on it to get into this proper education.
Bardzo dziękuję, panie profesorze.
Thank you very much, Professor.
Czy szczepienia są
Vaccinations,
bezpieczne dla kobiet w ciąży?
are they safe for
Jakie
pregnant women?
szczepienia powinny przyjmować
What
kobiety w
kind of
ciąży?
vaccinations
Jaki
should
wpływ
pregnant
mają
women consider and
dziecko?
get? And what is their impact on the child in their womb? Dr. Maciejewski, Director of IMIT. The floor is yours.
Thank you very much. I'm happy to have heard about the measles vaccinations, and please remember this is mumps, measles, and rubella conjugate vaccine. And every pregnant woman should be asked whether she is certain that she had been vaccinated. We might be convinced that all women have been vaccinated, and when they're pregnant, that they are. But with this coverage, we may meet in future situations when pregnant women have symptoms of measles and their infants have symptoms of measles. That is a situation that we might be confronted with. So in order for us to be safe and secure there, we need to speak to the pregnant women and ask them about their immunization calendar. So what is important is rubella, it is hepatitis B, as well as smallpox. Smallpox has been considered as a disease that is not so significant. We have it as children, but it can be a serious problem because in perinatal area, it is a serious threat to an infant where mothers has smallpox in that moment. So it is important to have vaccination against smallpox, chickenpox before getting pregnant. That would be 6 weeks before. While pregnant, women are recommended mainly the influenza and hepatitis vaccines. We have known that vaccines are safe for pregnant women since the 70s. And that was related to tetanus vaccine, then influenza. Another issue is that if women get vaccinated against tetanus, they benefit from it as well as their children. More current vaccinations are COVID, particularly, and RSV. In our institute, we can see high-risk children, the preterm babies, and RSV is a problem in that group. So where to get vaccinated? It's the gynecologist that qualifies a pregnant woman for vaccination, and the family doctor qualifies her to get vaccinated, and he orders the vaccination itself. During the lactation, if vaccinations are possible, that's not counterindicated. It is safe. Women use vaccinations when they breastfeeding. Seasonal influenza, it is disease that we know, and it meets all the criteria of the epidemic, and we may protect pregnant women against a severe course of the disease. Secondly, if a child is born and we can give the antibodies that come through placenta and through mother's milk, they can protect the baby, then the risk is lower. If they're not, then they transfer the risk on the infants. Yeah, we may be vaccinated against influenza both while pregnant and breastfeeding. Next item, pertussis. It seems that we might have forgotten about it, but it's not a disease that needs to be forgotten. Just like with the measles, the pertussis incidence rises. The time when the immunity is reduced after the vaccination is 8 years. So in order to boost it, particularly while pregnant, the vaccination is recommended, and it's a 3-valent vaccination of tetanus, diphtheria, pertussis. It should be at least 4 weeks to have the adequate level of the antibodies in pregnant women. So that's what we offer before pregnancy and in third trimester, 27th to 36th week, and the 14 days after the vaccination, we have maximum production of antibodies, and the transfer through placenta happens after the 30th week. Vaccinations are safe both while pregnancy and breastfeeding, and we recommend them for all women. Now, in terms of the vaccination schedule for women who plan to get pregnant and those who are pregnant, that's what we propose. Hepatitis B, smallpox, rubella, diphtheria, pertussis, measles, mumps, rubella. Of course, the women who were vaccinated should have the level of antibodies verified to see whether their immunity is sufficient. With the seasonal diseases, we take adequate steps. Now, COVID is a new thing. We start promoting it in pregnant women. We haven't had many of those, and it's not reimbursed yet for pregnant women, but it is reimbursed for everybody that is older than the average age, so to speak. And at the end, I would like to tell you as well that I use the materials that are available in public domain at the at the website of the National Institute for Hygiene, and you may just download the materials and then use them to promote knowledge and to encourage people to get vaccinated. It is a simple language, and it is very well presented. Thank you very much, Doctor. So we heard about pregnant women, and we'll hear now about preterm children. What diseases might be particularly dangerous to premature babies? What vaccinations are offered to them, and how health situation of preterm babies changed? Professor Eva Helwig, National Consultant in Neonatology.
Thank you very much for your presence here. Good morning, ladies and gentlemen. The group of children, preterm babies, This group of population was forever the reason for this quietness among pediatricians before their chances for proper development and for survival are not equal to children that are born on time. So this group of children, of newborns, has always been in the center of attention. Right now we are able to rescue children that are born earlier and earlier. The progress of medicine is immense here, and we do our best to protect this group of population. What is the group of children we are talking about? So these are children that are preterm babies before 37th week of pregnancy, and it is around 7.4 birth rate of all the children in Poland. The yellow line is children born with a birth weight lower than 2,500 grams, and we can say that every 13th or 14th baby is born premature. Right now in Poland we notice immense drop of birth of children in general. Last year we have 272,000 of children born. So we have around 20,000 children less than in previous decades. And as I have said previously in the beginning of my presentation, we notice a large premature birth weight and development of those children, which is a challenge for our medical staff, which is, even though those difficulties are there, we are quite successful. Why do we provide vaccines so early in their life? Because we want to gain adequate status, immunology status of those children. They are born with their immune system, which is not well developed. However, they have a large number of competent cells, and they can react properly to vaccines. Vaccination is realized according to their calendar age, which is chronological age. It is an exception concerning this population of newborns. All other information is calculated according to the corrected, adjusted age, which is the age prolonged by the time they were born, the months added concerning their premature birth. Now, the first vaccination, which is obligatory after the birth, is the hepatitis type B vaccination. Professor Parandowska has already said that in Poland this vaccination has been introduced in the second half of the 90s. So all the mothers that are giving birth are already vaccinated, but not all of them. Therefore, this vaccination is still obligatory. And it is delivered in this population in the 4 doses schemata, so directly after birth, within the first 12 hours of life of the child receives this vaccination. Why so early? Because infection with this virus in preterm baby can be very fatal, especially the liver can undergo really quick changes and deterioration. Consequently, vaccination here is very efficient, even if we do not use immunoglobulin. The second vaccination, which is delivered so early, just after birth, is the tuberculosis vaccination, BCG. Not all the countries vaccinate against tuberculosis. We still continue this vaccination, and we are going to do it up to the moment where we have the incidence with tuberculosis below 15,000, and right now this level is too high. And we can say right now that preterm babies' incidence with tuberculosis has dropped dramatically. During the last decades, we've had only 2 infections with meningitis in newborns. And when you go to cemeteries, especially old cemeteries, you can see tombs of small children, and it was mainly due to tuberculosis in the infant stage of life. Right now we have research into a new vaccine. It is a very benign vaccination which does not bring any significant side effects, adverse reactions to vaccination. When we talk about the preterm population of newborns, those that are extremely preterm receive the vaccination later on. We wait until they are more than 2 kilos. And we are not providing vaccination to children which do not have a stable health state, with children with problems with breathing, and we are not providing vaccinations with innate immunization problems. This is the population which is going to be covered by newborn screening, so we are going to know the numbers soon. We are not providing vaccination, tuberculosis vaccination, to children whose mother have HIV disease. In such cases, we always consult given cases with very concrete research, concrete information, and we get information from specialist doctors. Professor Pradowska said that for some time in Polish vaccination calendar we have rotavirus vaccination. We have to be aware that preterm babies, especially the extreme preterm babies, are in hospital after their birth for many weeks, even months. Since a dozen of years, neonatologists decided to provide vaccination to those children even before they are discharged to their homes, in order not to waste time and provide them immunization against the most dangerous to them diseases. And when they are discharged to their homes, they will be in touch with, for example, rotavirus. Rotavirus is a very specific situation because we have to be able to provide it up to a certain age of the child. At the age of several months in newborns, we can witness serious complication after this disease, even requiring surgery intervention in the area of intestines. And we do our best to provide this vaccination even in the preterm birth ward of children, to provide them with the first and second dose of this vaccine, and we pay attention to this. Ladies and gentlemen, in order not to get lost in all those dates, we pay lots of attention to necessary documents. Apart from noting the vaccination down in the health booklet of the child, we provide this information in the hospital discharge card as well. This is information concerning vaccination doses and their dates. It is very important in case of rotavirus vaccination, but also in case of any adverse reaction of vaccination observed during or after the vaccination and during the child's stay at the hospital ward. In most cases, it's a great majority of cases that has a very good situation, and there are no adverse reactions of vaccination. However, if there are such reactions, this information should be put in the child's health booklet. Children which are born on time, when they are discharged from the hospital, they are signed up in the local clinic, and they undergo immunization and vaccination during the coming weeks. And children receive vaccination in hospital wards. The preterm babies receive vaccination in hospital wards in order to make their state of health as safe as possible. We would love to have all the children to be vaccinated with multiple vaccines in order to save them from pain, because this is the case in many situations. However, this is financed by parents, unfortunately. We do not have such a possibility in the National Health Fund, and we are doing our best to provide such vaccination because it is very important for preterm babies. In case of such early vaccinations, after the child is discharged to home, vaccination should be continued by pediatricians, by the family doctors who are responsible for proper realization of the binding vaccination calendar of the child. Ladies and gentlemen, in a sense, children which are preterm are privileged. Why? Because their parents are very anxious about their further development and survival. Such children also spend many weeks and months in the hospital ward, and we have time for such vaccinations. This is our opportunity, and this is necessary. It's obligatory for us to discuss with parents vaccinations, and we see that in preterm babies, refusals for vaccinations have the lowest percentage. Why? Because parents get educated and they can see our effort for saving the child, for rescuing the child, for making it safe, for making its development proper. And we also provide information concerning vaccinations. When we talk about a given date about vaccination, we also inform parents about drugs concerning pain and fever. So we provide this information in time before vaccination. Ladies and gentlemen, today we all know that the best method of reducing incidence, especially in preterm children, is proper realization of vaccination calendar. Education among parents has immense importance. It makes parents trust our words, and we do not provide information to them at all. Then we leave space for all other bad consultants that reach such parents. Right now we have a pilot program concerning developmental care for preterm babies. The Institute of Mother and Child is the leader of this program. This program has been launched in 8 locations in Poland, and it is a very complex and difficult program of supervision over preterm babies, and the supervision over the vaccination program has a very important part in this program. Thank you very much for your attention.
Thank you, Professor.
Jak wygląda sytuacja związana ze szczepieniem polskich i ukraińskich?
What is vaccination status of Polish and Ukrainian children? Now, I would like to invite Alicja Karnej, Deputy Director of Clinical Affairs of the Institute for Mother and Child. Good morning, ladies and gentlemen. I'm waiting for my presentation.
Szanowni Państwo, 1 lipca 2022 roku
Ladies and gentlemen, on the 1st of July 2002, the Ministry of Health signed a contract with the Ministry of Health about the vaccination of refugees from Ukraine. The Institute started this cooperation with the Ministry of Health and UNICEF under this campaign. What was important is the situation and information that we had at the time that in Ukraine, children are not generally vaccinated to a high percentage. It was from 60 to 99%, depending on the type of vaccine. In the first 6 months of 2022, according to Ukrainian Center for Public Health at the Ministry of Health of Ukraine, the data was below 40%. We also had information about the polio cases in Ukraine. Ukrainian parents, when they came to Polish doctors to talk about vaccines, they often said that their booklets have signatures, but actually the vaccination never took place. So it was difficult to actually collect the data and analyze the documents about what vaccinations the particular children had. Ukrainian calendar of vaccination is similar to a Polish one, which was helpful. It has 10 obligatory vaccinations. What is missing there is against rotaviruses and pneumococci. We took into consideration a fact of what priorities of WHO were, which were namely measles, mumps, rubella, and tetanus, diphtheria, pertussis, hepatitis B, and and COVID-19, according to what the Ministry of Health recommended. In Poland, we have a binding legal provision, and we know that people who are in the territory of the Republic of Poland more than 3 months, they are obliged to be vaccinated. So to facilitate vaccination of Ukrainian children, a principle was introduced that even if people don't have the documents, the child is treated as non-vaccinated. We did not recommend serological tests to verify the immunization status, but in hospitalized children that had unknown status of hepatitis B vaccination, we just checked the anti-HBs antibodies to verify. Now, the principles of vaccinating refugees were as following. They were free of charge in the first-line doctors, though we didn't have to have translation of the calendar of vaccination, and it was individualized. People who did not receive vaccinations were the ones that had counter-indications, and those who were vaccinated shortly enough to have immunization maintained. We knew who would help us most to actually promote vaccinations. Obviously, the healthcare professionals, the doctors and nurses, as well as the administrative staff of health centers. We all play a key role in initiating and maintaining efficient communication about vaccines, and also about in maintaining high vaccination rate by providing good educational materials, answering questions and addressing doubts, and also making sure that a parent who is prone to vaccinating the child will make an appointment and actually will come and at a given day. So we started a campaign. Campaign is called Say Yes to Vaccinations, and it was a hard work that took a long time, but it was rewarding. It was large scale. We had lectures, webinars for doctors, nurses, and administrative managerial staff. We created a help desk, call center, and educational materials for Ukrainian parents and psychologists and doctors to actually promote vaccinations. We had video, radio, PR campaigns, and we had a picnic, Dare to be healthy. What were the results now? We also address the myths, providing facts. We talk about how important vaccinations are. Well, did it help? Forgive me, I went too fast. Let's go back. Let me stop you there for a moment. Did it actually help us in having more children vaccinated? What we hoped for, actually, was that we would have a sort of side effect of a campaign that more Polish children would get vaccinated while we were campaigning for Ukrainian children being vaccinated. It's difficult to provide a response now because we don't have precise statistics. I hope we will have them this year. As we know, the first year of war was difficult, and the whole campaign was just kicking off. The last year was actually the year when we could have statistics. The sanitary office also started collecting data about people who refused vaccinations and refugee population as well. So what we saw presented by Professor Paradowska about the vaccination coverage in our country, and I'm not going to actually describe it further because Professor addressed it quite thoroughly, but let me tell you that the increase of people who refuse vaccinations is growing year by year, and it's worrying. We have a 50-fold increase in more incidents, measles in Euro-Asian region, and there are 10% more children in some regions of Poland that are not vaccinated against some diseases, particularly the measles. In order to have the population-wise immunity, we need to have 9 in 10 children vaccinated. We have anti-vaccine movements. Currently, the state of health of many Polish citizens is not best of the pandemic. People have long COVID. Plus the war in Ukraine, all those elements, unfortunately, lead to a fact that there's less vaccination, there's more incidents, particularly in infectious diseases come back. That is why we need to promote vaccinations, most of all. So let's trust vaccines and let's say yes to vaccinations. Let me take one more moment. We had an article in 2023 that addressed the parents' attitudes towards vaccinations regarding the Ukrainian migration in Poland in 2022. It was a questionnaire that was done online, and colleagues from the University of Warsaw and Infectious Hospital in Warsaw provided the research and the results. 541 questionnaires were analyzed, and as a result, showed that the inflow of Ukrainian refugees made parents in Poland, it had impact on decisions of parents in Poland to vaccinate their children. 10% more got convinced. Is it a lot? Yes and no at the same time. Thank you very much.
Good morning, ladies and gentlemen. Once again, we have some organizational information with our organizers. Our plan right now to connect to University of Yale in Connecticut, but we do not have this connection now. We'll have it later. And I will tell you a few words about this publication. I guess each of you has it there. It is an exceptional edition, the first in the world, because it shows the share of vaccination coverage. It shows everything that influences the decision of people who came to Poland with children from Ukraine. And it shows types of problems and barriers making them refuse or avoid such vaccination. And this publication, this report, which has been available on the official website of UNICEF for the last 2 days, will be the subject of discussion today. I'd like to invite Ms. Agnieszka Sochoń to take the floor here to tell us a few words about this report. It is a very intriguing title, Vaccines, More Important in Crisis, More Important Than Anywhere in Our History. Can you tell us a few words about this research? Thank you very much. Yes, we are going to present it together with Sarah Christie from Yale. I'll start with my presentation and results of the research. My name is Agnieszka Sochoń-Latuszek and I work in the UNICEF office for reacting to UNICEF Refugee Response Office in Poland. And together with Sarah Christie, with SWPS University in Poland, we present the research. We have worked on this research together. Conclusions from this research is published in the most recent booklet you have here and at the reception desk. You're especially welcome to learn information from this publication. We talk about vaccination of children in conflicts, and why vaccination now is more important than any time in the history, because it touches on behavioral intervention. Today we have talked about vaccination from the medical perspective, but we will move on and discuss behavioral aspects of it, because our department is working on behavioral aspects. I'd like to thank the project team, which you can see on this slide, and experts and researchers, medicine experts, behavioral experts. Participation in this research was priceless. We also want to thank the participants who shared their opinions with us. What was the goal of the research? We wanted to learn about the experiences, beliefs, and attitudes towards vaccination of caregivers of Ukrainian children living in Poland, but we also wanted to learn the healthcare professionals' opinions, because we wanted to have those two perspectives. The final goal of the research was to prepare behavioral intervention to help promote immunization and respond to identified barriers, and to reach successfully children and parents coming to Poland and convince them successfully to vaccinate their child. Methodology of our research covered mixed attitude, mixed methods. We used quality and quantity methods. In quality methods, we talked with healthcare professionals, and we also had focused discussions among health caregivers from Ukraine. Quality method was online poll, and we invited mothers, Ukrainian mothers living in Poland. We managed to gather response from 2,000 such mothers. It is a large number. There was also a controlled trial where we presented various behavioral interventions and various approaches. When we talk about methodology, we need to mention a behavioral drivers model. This model has been developed by UNICEF, and it looks into the factors that influences our behaviors. We look at psychological, environmental, and sociological aspects, and I'm going to present the results discussed within those three pillar framework, which have large impact on our behavior. I'll start with the results of quality research and psychological factors. In psychological factors group, we focus on the three main factors. Those three factors, out of many others, are the most important. The first is cognitive prejudice and limitations. They tell us how we analyze new information, and we can see that not all information reaches us, and we analyze in the same way good and bad information. Quite often, healthcare professionals tell us that we are apprehensive concerning adverse reaction to vaccination. There is disinformation, and it all influences decision concerning vaccination. This subject is repeated. The second aspect concerns rationality, limited rationality. It says that we do not benefit from all the information resources, even if we have access to them. All of us in this room work with parents from Poland and from Ukraine. We know that information is available also in the Ukrainian language, but not always we are able to analyze those information. For example, we have some time restrictions, and caregivers from Ukraine do not have, for example, time to process this information. That's why they tell us that they did not get much time to process the information and their decision was not adequate. There is one more aspect concerning interests and individual features of people. When we talk with caregivers from Ukraine and healthcare professionals, we see that they are all interested in good welfare of children, good state of children, and information prepared in Ukrainian would be very useful for learning about how to make the situation of children better. Another elements are social factors. They have great importance and impact on our decisions. We may say that this impact is even bigger when we are in a new country, in a new environment. We are even more willing to be dependent on our own circle, on the circle of people from our country. Therefore, it is a good information for us concerning how can we convince such inner circles towards vaccination and how to provide sources of information which are trustworthy, because they quite often have difficulties in getting such information. When we talk with healthcare providers from Ukraine and healthcare professionals, we gather lots of positive information and we focus on those challenges we need to address. We can see that the objective evaluation of healthcare providers shows that people from Ukraine may be quite demanding concerning vaccinations, and when we look at the group of their group says that they are treated differently compared to the group of caregivers from Poland. They do feel that there's a lack. The equality is not sufficient. Now, communicational environment. Here we have to mention language barriers, which is a recurrent topic. Healthcare professionals and healthcare providers from Ukraine mentioned this barrier. We know that the healthcare professional has the same amount of time for a given visit to a Polish person and to a person coming from Ukraine, and sometimes this time is not sufficient for explaining all the medical procedures to a person coming from Ukraine. So these are the equality factors mentioned beforehand, and it may have some negative impact on the decision concerning vaccination. Finally, structural barriers. We have already mentioned this. There were certain information concerning documentation. We know that there's no obligation to move on the vaccination card, and there is still the barrier. We had caregivers from Ukraine saying that that was the reason for which they couldn't vaccinate their child. Their vaccination card was not translated into Polish. Sometimes when we have vaccination calendar, we do not have time for translation, and we need to face this in a way. Now, quantity research, quantity methods, it was the focus group was 2,000 mothers with children aged up to 8, which came to Poland after the February 2022. Now, some data concerning quantity, so we can see the scale of the discussed problem. First of all, we wanted to learn a bit more about how mothers feel when they navigate in the new healthcare system. 1 out of 3 mothers do not know how to vaccinate their child in Poland. This is quite a high share, especially when we look at the group of children of mothers with children aged up to 7, when there's lots of vaccinations. We also asked them whether their children are vaccinated according to the Polish vaccination calendar, and many such mothers said that they do not know, and 16% said that they are partially vaccinated. This is the information we should address in promoting vaccination. We noticed this tendency, and we asked for reasons concerning why they didn't vaccinate their child. The reason for failure of vaccination, most often mentioned by mothers, seen in this slide, is lack of knowledge concerning vaccination calendar and requirements in Poland. Another was that the mothers were apprehensive concerning adverse reaction to vaccination. The third information was that they didn't know where to vaccinate their child. The fifth 14% says that they prefer to vaccinate their child when they come back to Ukraine. So mothers are ready to come back to Ukraine, which is facing a war conflict, so that they can vaccinate their child in a system which is well known to them, which also leads to delayed vaccination. Now, barriers concerning access to healthcare services and how to counteract them. Here we asked mothers whether they face certain difficulties, and they responded that either they didn't want to get access, or 10% said that they faced certain barriers when they wanted to get vaccination. They faced mainly difficulties concerning understanding the doctor. That was the problem concerning language and communication, and difficulties in getting the date of the visit. We asked respondents, what can we do to react better to their problems? Majority of them said that they need to have more time concerning vaccination card of the child. That was the recurring answer. And they also wanted to get information in the Ukrainian language. When we talk about the Ukrainian language, the mother tongue of our respondents, we need to mention language barriers. And we have the problem mentioned by the healthcare professionals and caregivers from Ukraine. Communication barriers in the subjective evaluation of mothers was very important. They thought that their knowledge of Polish is at the lower level, or they even said that they do not use Polish language and they live in Poland, and for them this is a great barrier, especially when we talk about medical procedures. 17% of them had problems concerning translations of their vaccination cards and cards of their children. Another subject which needs some phases is a very positive aspect in the perspective of what we are discussing today. We can see immense trust bestowed in healthcare professionals in Poland. I think this is the result of immense work performed in the beginning of the conflict, work performed by the Ministry of Health and the IMIT and other professionals. Many people trust healthcare professionals in Poland, and information from this source concerning vaccination is trusted information. We also have doctors which enjoy this trust, and I would also like to draw your attention to answers saying that they also trust information from other parents from Ukraine and from social media. And we know that verifying information from social media groups of parents which share their experience is the source of information for parents who discuss vaccination, and maybe we should be present in such groups, we as the healthcare system. Now the behavioral experiment, behavioral research we have conducted. We wanted to learn opinions and barriers. We wanted to test a concrete tool which could be more efficient in reaching people from Ukraine and influencing their positive decisions concerning vaccination of children. The behavioral experiment comprised offering various information, various messages to groups of mothers, of Ukrainian mothers in Poland. We had 4 groups. 3 of them received such information based on conclusions from behavioral science, together with IMIT Institute and with Yale School of Medicine, with Sarah Christie, which will join us today. We worked on it and we will share information together. We worked on how such messages influenced the decision on vaccination and for setting the date for vaccination. 3 out of these behavioral interventions referred to low trust among healthcare professionals. The second difficulty was accessibility, and the third concerning aversion to risk, emphasizing the particular situation of Ukrainian mothers in Poland. Now the results. We noticed that the aversion to risk, this is a very special situation the Ukrainian mothers in Poland face, influenced their decision. And we could see the increase of intention for vaccination after our message, and they were more willing to click the button to set a date for vaccination. Ministry of Health and IMIT are our partners in developing methods of developing our messages in order to reach the group and convince them to vaccinate children. We have authority, for example, a healthcare professional, we emphasize their unique situation and we share this information in a very easy way. We have certain direct steps here and we share this information in the Ukrainian language, which is very important. Now, recommendations. Here we divide them into various recipients, the institutions of healthcare, communicators, all the groups, and we think that we should be ambassadors of vaccination. Healthcare system should have campaigns using behavioral methods, information campaigns concerning behavioral methods. I think we should simplify this information so that they are easier to understand. We should distribute them through adequate channels. We should use official sources of information, but we also should think about how to reach such parents, maybe through social media. We should identify ambassadors of vaccinations. We know that parents exchange information among caregivers, and maybe we should know people who could promote vaccination in this group. Among all the groups, we should take into consideration exceptional situation in the case of promoting vaccination, because here we are more willing to simpler analysis of information which concern us and our situation, and it concerns people from Ukraine who are subject to such exceptional situation. And we should take into consideration their situation in promoting vaccines. Thank you very much, and I'll give the floor to another person.
Proszę Państwa, mamy połączenie z
Ladies and gentlemen, we have connection with Connecticut, with Miss Sarah Christie.
Hello, early in the morning. It must be early in the morning. What is the weather in your country?
Well, it's still very chilly here, but it's tolerable. We're getting to spring now.
Yes, okay. Pozwoli Pani, że przejdę na język polski. Jak wyglądała
I will speak Polish, and you will receive translation. What is your perspective concerning cooperation with this partner in the Yale School of Medicine? What was your cooperation here?
Surely. So we were delighted to work with ADA and the UNICEF Poland team to really support routine immunization demand among mothers of young children in Ukraine from Ukraine who had moved there. And it's really important and vital that we get the right messages to the right people, and learning from those who are experiencing this situation was vital to our effort. We're so grateful for the collaboration and really wanted to support this very urgent need in the country. And I can't say enough about how wonderful it's been to work with this partnership, as well as with European CDC, my colleague Dr. Michael Winters, as well as the entire UNICEF Poland team. And we've had also worked with UNICEF Ukraine in the past, so just very delighted to collaborate on this important mission.
Proszę powiedzieć trochę więcej. Jak Pani
Please tell us a bit more. How do you evaluate the results of this research? The title is very intriguing, Exploring Barriers and the Importance of Behavioral Interventions. Please tell us a bit more why you focused on these aspects in your research.
Sure. So we know that vaccine is a health behavior, vaccination seeking is a health behavior. So it's really important that we follow a process of getting to the right messaging campaign. So we always begin with the data and learning from those who are experiencing the issue firsthand, particularly healthcare workers and patients themselves, or parents themselves in this case. And we always consult the behavioral science, behavioral drivers model, because that really gives us clues into how we should approach this situation from a holistic way, not just through barriers or facilitators, but through different levels of factors that might influence behavior. And it's just really important that we take that process through from creating the messages based on the data, based on science, consulting with communities about what those messages would be, testing those messages before they go to scale in a large-scale campaign.
Czy wyniki tego raportu zaskoczyły Państwa?
The results of the report were surprising for you. What can we do next?
Yeah, no, I think we were all looking forward to the results, but I think we weren't surprised that parents will always focus on their children, and highlighting the risk of disease in this situation, in an already vulnerable situation. It seems to have moved the needle in what they can control, and it led to higher intent to vaccination and higher clicks on the link to schedule. So we feel confident that the results shared highlight a very specific situation, and that parents are very concerned about their children in this situation and are wanting to get them vaccinated. So they were not surprising, but they were very hopeful moving forward.
Jakie są konkluzje?
What are the conclusions?
Co według Państwa jest ważne, żeby
According to
zmienić, co
you,
zrobić,
what is
żeby poprawić
important
sytuację, żeby
to
mówić
improve the situation?
jednym przekazem, żeby stworzyć jeden
To
przekaz?
have one message. What to do to have one message to improve the situation?
So I think just speaking to the specific situation of moms who have relocated to Poland in this situation is highlighting that vaccination is easy to access. It is accessible. The materials are accessible, bilingual, as Aga said. That we highlight that there is a risk if children are not vaccinated on time. But the very key part and most important part is that there is an action that they can take to remedy that. So we never want to put a risk aversion message out there without giving a pathway to action, which is exactly what the experiment did. They could click on a vaccination scheduler and take action right away. So I think in terms of a cohesive message, that will be the way forward. A very simple, straightforward way to get children vaccinated and highlighting that parents are in control of that.
A jak sobie Państwo radzą u siebie w Stanach? Czy jest
And in the
podobna,
United States,
podobna
how do you
trudność
cope with it?
językowa,
Do you have
trudność
difficulties in
komunikacyjna,
language, in
krótko
communication?
mówiąc, łatwiej
In
jest
short,
przekonać
is
mamy
it
dzieci do
easier
szczepień,
in the
czy-
USA to convince mothers
czy
to
też jest
vaccinate their children, or do you face such a problem as we here in Poland?
No, I think it is. The U.S. is facing a slight depreciation in vaccination rights, which had been very steadfast for several years. We have strong regulation for vaccinating children in before school age. So, but we have seen lower rates of vaccination than we had in previous decades. So I do think we have similar problems. We're still trying to also cope with those and make sure that we can restore trust in the medical system and get all children vaccinated as they need to be on schedule. But I think trust is key, and given the trust that you're seeing in the survey, you're ahead of the curve, and that's very exciting because it means that the voice of health workers and the Polish health system will be strong in convincing parents to come forward and vaccinate their children.
Taki Pani pomysł, taki Pani przekaz.
Can you
Co
have
zrobić, żeby
a
ten
message for
żeby przekaz
parents
związany ze szczepieniami był
about
bardziej,
vaccinations? What message could be more convincing,
większej liczby
that,
osób,
a
żeby
one that
przekonać
could
do
reach
szczepienia?
more people and convince those who doubt?
So I think, I don't think there is a one message. I think exactly as Aga has presented, we have to test different messages based on what we're hearing from the ground, based on evidence. I think the key message for our healthcare workers is just to make vaccination as easy as possible. A lot of the barriers that we're hearing about are in terms of access versus hesitancy. And so the easier we make vaccination, the more people will trust vaccination as well. And so, that's what I think is, the key message is really there isn't one message that's going to work for everyone. But as long as we as healthcare workers continue to rebuild and retain trust and also address barrier issues, we should be helping to promote vaccination.
Bardzo dziękuję. Thank you very much, Sarah. Sarah Christie, specjalistka do spraw badań zdrowia publicznego. Yale
Sarah
School
Christie,
of
specialist on
Medicine z
public
Connecticut.
health
Bardzo
from
dziękuję.
Yale's
Thank you very
University
much
of Medicine, Connecticut. Thank you very much.
for the
Thank
interview.
you.
Thank you. A teraz chciałam zaprosić pana doktora
Now,
Marka
ladies
Muscata
and gentlemen,
z
let me invite
Nacionalnego Światowego
Marek
Organizacji
Muscat from the World Health Organization Regional Office for Europe to tell us about the importance of addressing immunity gaps. What does it mean, immunity gaps, and why is this important to actually eliminate them?
Thank you, dziękuję. Right. I think by now we are quite aware of why we want to eliminate these diseases and stop them from happening. So I'd like to address the importance of closing these immunity gaps within the population. And the obvious first point is to protect unvaccinated individuals, children, adults, adolescents, and also populations, not just individual people. We don't want to protect also populations, because when microbes enter into population groups, that's where outbreaks start occurring. So we want to protect individuals, we want to protect population groups and communities. And that will result in a reduction of morbidity, a reduction in complications that these diseases often bring with them, and also in some cases also deaths. In doing so, we prevent outbreaks, and we also want to mitigate the burden on the healthcare services, because once we start having outbreaks of measles, of pertussis, then this is a burden on the healthcare system, a burden on the healthcare providers. And of course, the ultimate goal is to improve the health of the population. That's what we want. This is a slide showing the number of measles cases that were reported in the WHO European region, which consists of 53 member states. And you can see in the bars, the blue bars, the number had increased in 2018 and 19, and that was driven by large outbreaks and measles cases being reported from Ukraine, which was exported to other countries, including Poland. In 2018 and particularly 19, there has been quite a resurgence of measles reported in Poland. And then during the COVID pandemic years of 2020 and 2021, there was a drop in the number of reported cases, also because of the measures that were being taken really protected from respiratory diseases from taking place. And then in 2023, we started seeing outbreaks taking place. And these outbreaks within the whole region, particularly in the eastern part of the region, actually started increasing again. And why is this? We noticed that the regional coverage for the first and the second dose of measles-containing vaccine dropped from 94 to 93 and 92 to 91% respectively. And you might think it's a very small drop in percentage. Why are we seeing such outbreaks when the drop is so small? Remember, this is a coverage at a regional level. But when you look at the countries, now this is a spectrum of all the 53 states. They're not all named because the graph is otherwise will be too big, but there are names there corresponding to the country names corresponding to the bars. And in some countries, not performing that well, with coverage as low as 32% for the first dose of the measles-containing vaccine. Many other countries are doing quite well, but you see, for those countries that are not doing very well with coverage, the area which is marked in red is actually representing the percentage of the population that is not being protected. And we see this not only at a national level, but also at a subnational level. So when a country reports 95% coverage at a national level, it means that there are also subnational levels which are not doing very well. They might be actually doing quite low, and we'll come to that in a minute. This is just to show you the incidence of measles in 2023, from March 23 to February 24. It's a 12-month period, and the highest incidence is occurring in the eastern part of the WHO European region. The highest number of cases so far in 2023 during this period was reported from countries like Kazakhstan, Azerbaijan, and Russian Federation, and also Kyrgyzstan. When we looked into the epidemiological data, just very basic data, age group, the largest proportion of cases in 2023 occurred between 1 and 9 years of age. That's 52%, with the highest proportion occurring between 1 and 4 years of age, that's 31%. And most of the cases were unvaccinated, 0 dose, you see on the graph on the right. Most of the cases were unvaccinated individuals. And if you look at the population immunity, this is no surprise that it's children that got the brunt of the disease. This is an immunity profile for Poland. It's a rough estimate based on the vaccination coverage that was reported. So what you see are the birth cohorts by year from the x-axis, and you can see that the blue bars are the proportions that are immune to by age, and the red bars are the ones that are not immune. And because of the COVID pandemic, less and less people had their children vaccinated. This is one explanation. It's one factor. It's not the sole factor, but there are other factors. As we heard today, also unfortunately, a lack of trust being developed. So the most vulnerable are the very young and the older individuals who, for some reason, did not benefit from being vaccinated because they were either too old when the vaccine was introduced or for some other reason. So this is the reason why, I go back, we are seeing a high proportion of children, but also there is a small percentage, but significant percentage, around 10%, that are occurring among adults above the age of 30. Like we heard today, the healthcare worker being affected by measles. For a disease that is considered to be the most infectious disease, measles, you need a very high coverage. You need 95% coverage. So I worry when I see a national coverage of 90% for Poland. I mean, this is quite worrying. When you have a 95% coverage and you get an importation, like in the top right graphic, showing an important case of measles, that doesn't go on further because there is a high herd immunity. But when the coverage is less than 95%, and in this example, I'm showing 80% coverage, then you have more people who are unprotected. As soon as you have an importation, of course, then this is a minefield. You know, the virus, being so infectious, just spreads. And it seems like it wants to identify those people who are not vaccinated and causes then an outbreak. In the past, and this seems to continue also today, we have measles outbreaks occurring, therefore, among unvaccinated children, unvaccinated adolescents, and unvaccinated adults, but also certain specific communities. For example, ethnic or minority communities. Roma communities have often suffered repeatedly from measles outbreaks in Europe. Then we have religious or philosophical groups, for example, the ultra-Orthodox communities in the UK and in Israel. They repeatedly come with outbreaks. Philosophical groups, for example, followers of Rudolf Stein philosophies, and also, unfortunately, healthcare workers. We see outbreaks occurring nosocomially, affecting also healthcare workers. There was a quote and I think this is interesting, saying measles could be called the equity virus. Without vaccination, everyone gets measles. And without equitable healthcare systems to deliver vaccination, measles will continue to present a threat to the most vulnerable. And I think we have to keep that in mind. This is data from Poland. MMR1, measles, mumps and rubella vaccine first dose, and MMR2 with the second dose, between 2013 and 2022. And you can see the decline of the uptake going down from left to right. But particular voivodships were affected. So, for example, Mazowiecki, you see the red line below, it's one of the lowest coverage in the whole country. There's also Podalski, if I say it correctly, and Łódzki. Yeah? And that's for the MMR1. For MMR2, we have Mazowiecki also, one of the lowest, and Podkarpacki. Yeah, okay. I'm looking at Paulina. This is, again, to show it's the same data, but presented now in a geographic way. You can see the circles are indicating the lowest coverage in the whole country from 2017 to 2022. And it seems like repeatedly the same three voivodships have the lowest coverage year after year, except for 2021 when there was Lubelski having one of the lowest coverage. This is for the second dose. Again, repeatedly, Mazowiecki seems to feature as one of the voivodships with the lowest coverage, but also Podkarpacki. This for the second dose. WHO, particularly during the COVID years, anticipated that this was going to happen and has produced a document in helping countries making operations to consider considerations for planning and implementing catch-up vaccination for those, particularly for those children that were not vaccinated because of the pandemic period for some reason or another. There are recommendations on how to intensify any catch-up programs or to target and select mass vaccination campaigns, and also how to carry out supplementary immunization activities. So there is some policy and operational considerations for countries. These are just a few examples of how to reach and maintain a high population immunity. So these are things that, for example, that can be implemented to maintain a high coverage. So vaccination registers with reminder systems. In this day and age of electronic communication and data management, it shouldn't be difficult to have a vaccination register which is electronic and to issue reminders before a child is due for a vaccination, and if that child has not been vaccinated after a certain amount of time, then there would be an electronic reminder to the parents to take their children to be vaccinated. Supplementary immunization activities, tailoring immunization programs is very important for particular communities that do not fit the normal system, the normal way of being covered, reaching out, having access. So the immunization program has to be tailored to reach out to those particular groups or populations. Reminding doctors and vaccine providers to vaccinate at every opportunity that a patient, when the patient comes to the doctor, the doctor could ask, are you vaccinated by any chance? What's your vaccination status? So taking opportunity of any medical visit for whatever reason to make sure that people are vaccinated according to the national schedule and according to the time. One other thing which seems to have worked in some countries is so-called preschool entry policies. So, for example, schools would require just to look at the vaccination records of the students and to ensure that parents are reminded that certain vaccines are missing. Just reminder systems, really. It doesn't have to be, enshrined in legislation, because these things can take a lot of time. But it should be kind of spontaneous. Let's make this a kind of good practice for schools to check the vaccination status of children, or kindergarten, or daycare centers before they are admitted to the educational institution. Pre-vaccination travel, I think we should actually give a little bit more importance. How many times we have heard of tourists going abroad, coming back with measles or whatever other disease. It's important to make sure that travelers are well equipped, not only with their suntan lotions, but also with vaccination. And of course, healthcare worker policies, that healthcare workers are protected from getting the infection and also from transmitting it to particularly the patients who are probably already vulnerable, especially if they have some immune disorder. Just to mention the concept of equity. We talk about equity nowadays. What does that mean? When a healthcare service is there, it's provided for everybody, it's reaching out to everybody in a very equal way. There's a vaccine schedule, there are recommendations, and people get vaccinated. Children get vaccinated. So the service is equal to everybody. But not everybody can have that access. As you can see, the child, the small child, cannot see the game that is going on behind the fence. So giving the possibility for a game to take place and not everybody to see it is not treating everybody with equity. And therefore, the health service need to provide some extra help for everybody to benefit, in this case, to see the match, and in the terms of vaccination, to be vaccinated. And WHO is also producing guidance for countries to be able to identify who and where are these people, the unvaccinated individuals, why are they unvaccinated, and how to reach unvaccinated people. And then also a step to evaluate the program. So we are taking this one step further to ensure that countries have the proper guidance on how to deal with equity. And this is my last slide. For the European Immunization Week, available on the WHO website, there's a wealth of information. There are these fact sheets on the various diseases that the vaccines prevent. And it was my greatest pleasure to see yesterday that they are translated into Polish and also in Ukraine. I'm not sure if they're online yet, but if not, we'll make sure that they are as well. But these are also available from the WHO country office. Yes, and also I wanted to tell you that unfortunately, the director of the WHO country office, Dr. Nilo Berzulli, was not able to attend, and she would have loved also to promote, to be here and to promote vaccinations to you. Well, thank you very much for your attention. I don't think I have any more slides, yes. And I'm happy to answer any questions, or we can answer the questions during the panel. Yeah? Or now, as you wish. Later, okay, thank you.
Bardzo dziękuję.
Thank you very much,
Dr. Mark Muscat.
Dr. Mark Muscat.
Proszę Państwa, tak jak
Ladies
mówiła
and
pani doktor
gentlemen,
Alicja
as
Carney, od
Dr. Alicia
początku
Carney
wojny była
said,
prowadzona
since the
kampania
beginning of the outbreak of
Powiedz
war,
tak
we've
szczepieniom.
had
Bardzo
a
ważna
campaign
kampania,
Say Yes
która,
to Vaccination.
no,
It was a very
miała
important
przybliżyć
campaign which
z Ukrainy trochę
was
bardziej
to
jak
provide
bardzo
people
dostępne
from
i jak
Ukraine
ważne są
information
szczepienia w
concerning the
Polsce.
importance of
Ja
vaccination in
zapraszam
Poland
bardzo
and their
serdecznie
availability.
panią dr
Now I'd
Annę
like to
Dzielską,
invite
kierownik
Ms. Anna
Zakładu
Dzielska,
Zdrowia
doctor,
Dzieci i Młodzieży
head of the
Instytutu
Department of
Dziecka.
Child and
Przybliżenie
Adolescent
trochę
Health from
efektów tej
EMID.
kampanii.
I
Co
want she will present the results of those activities. Ladies and gentlemen, good morning. I think that the results of our activity will be visible in the coming time, and I will tell you a little bit about our work.
Poczekać. Dobra. Tak,
I
to
need
może
to wait a little bit for my slide.
Słowem wstępu o tym, jak do tego doszło.
And I will provide introduction. In 2022, when we faced the outbreak of war in Ukraine, the minister addressed EMID and the foundation of EMID to launch an urgent cooperation concerning securing Ukrainian refugees in terms of their mental health and in terms of public health as well. Public health concerned all the consequences of having large number of refugees in Poland. The needs were very urgent because we welcomed over 1.5 million of refugees in Poland, which were registered in Poland. We knew that among them there are many people who are not sufficiently secured concerning various diseases. We have realized this project together with the foundation of the Institute of Mother and Child, and we targeted the increase of the index of immunization coverage of people and children in Poland. So we needed to have a research of the situation here and now back then. We had gathered data concerning factors influencing the decisions of mothers concerning vaccination of their children. Back then, we didn't have that data. They were forced to move out of their country. They landed in Poland, and they had different needs than Polish mothers concerning vaccination. So immediately after the launch of cooperation, we've had a pilot study concerning the barrier of Ukrainian mothers in terms of vaccination of their children. We've had around 200 refugees from Ukraine. Most of them were mothers with children. They usually had one child. We asked them for vaccinations, for barriers in vaccinating children. We also asked them what are the sources of information they use and which of those sources are trustworthy according to them. Our research resulted in the possibility of creating a strategy leading to increasing the number of mothers that wanted to vaccinate their children and that set the date for the visit. The barrier was similar to what Agnieszka Sochoń said, but we need to noticing that what you can see is the result of research from 2022, immediately after the mothers came to Poland. But we can see that the results have not changed much. The results show that the largest barriers mentioned by those mothers concern availability, which means that they wait long for the visit, they don't know which disease they should vaccinate the child against, and one of the barriers is the language barrier, which is quite a natural phenomenon here. When we designed our strategy, we were invited to cooperate in an international group, and there were specialists for social behavioral change from UNICEF. We are very grateful for their assistance because they helped us to develop a strategy which is adequate to our situation and universal enough to be offered to all the countries that are accepting refugees. We did our best to direct the strategy to Ukrainian mothers, and we will do our best to increase the share of vaccinated children. We will implement this strategy in various accepting countries, and we will do it for the next 12 months. We want this strategy will take 12 months, and we want it to be simple enough for such mothers to accept it. This makes the strategy easy to implement, and it makes it possible for the mothers to trust the tools and the strategy. We also took into consideration the systemic approach. We know that behaviors are shaped in a certain system, in various systems, and they result from interaction among those systems. We also did detailed research in literature, and this is only one of the conclusions we want to share with you here. There are other conclusions. We take in strategy planning contextual factors and social group of the people we address. We also know that Ukrainian mothers should be the starting point of the strategy. Among the research we had access to, we noticed that Ukrainian mothers who came with their children to another country are the people, they are the group that is the decision maker. They take the decision. So we base the strategy on the behavioral models, the COM-B model. There are 3 components which are intertwined, and those 3 components have impact on the decision of vaccination. Vaccination, knowledge, capability, and capability are important. We have the ability to vaccinate, the motivation, and the possibility. These are the 3 most important factors. What are the activities we wanted to propose based on this model? Well, in terms of the capability, there are 3 goals: increasing knowledge, health skills, and awareness of mothers. Goal 2, supporting mental health of mothers from the Ukraine, especially through counteracting war trauma. And goal 3 is overcoming the language barrier. Goal 1 was to be reached thanks to educational campaign addressed to Ukrainian mothers. Those activities were targeted also healthcare professionals, neonatologists, gynecologists, all the doctors, the family doctors. It was to initiate cooperation with them, to give them knowledge which will make it more possible for them to communicate with Ukrainian mothers, to participate in courses, and to create media information in the professional literature which is useful for them in their cooperation with Ukrainian patients. When we refer to mental health support programs, one of the programs that was developed here was developed not for this target particularly, but it became a tool for supporting our strategy. It was a program developed in the Institute of Mother and Child by the Team for Children and Adolescents Health. It was a program for supporting parents. It was called Dodać Sił, Add Some Forces, and it was addressed to 600 Ukrainian mothers and parents. Its goal was to make it possible to cope with war trauma and to make resources available to solving other issues. Motivation. Here our strategy was to increase awareness that vaccination is really important. So we motivated mothers to consider vaccination as important and to increase their trust in vaccination. We also wanted to increase mothers' trust into healthcare system in the welcoming in the host countries. From our small research and thanks to the literature research, we knew that their trust to doctors other than Ukrainian is low. Mothers contact their own doctors in Ukraine. They carry on using Ukrainian healthcare system on the phone, for example, or through emails, and they do not benefit from a Polish doctor's offer. So we wanted to overcome this barrier as well. We wanted mothers to increase their self-awareness. We provided educational campaign targeting families which were hosting those mothers, and to organizations that were hosting those mothers, and to religious organizations as well. The last element resulting from our strategy was the component concerning capabilities, abilities. And here we had two goals. The first was to increasing awareness of mothers concerning possibilities and offer of the healthcare system of the host country. And the second goal, to increase structural efficiency of the healthcare system. Of course, not all goals in this universal for all the countries strategy are to increase the frequency of vaccination of children. Not all of the goals were possible to be implemented by the IMIT institution and the organizations that were cooperating with us. But the goals that we could implement are the goals visible in my conclusions. These were the most urgent needs which we were able to respond to. This is overcoming language barriers, educational campaigns, improving social functioning thanks to the program for parents, which I have mentioned, increasing knowledge among the healthcare professionals thanks to training and education of the staff, and initiating cooperation with media and non-governmental organizations, including religious organizations, increasing awareness of vaccinations among Ukrainian mothers in Poland. Thank you very much for your attention. Thank you very much for your presentation. Now I would like to invite Dr. Katarzyna Lewtak from the Department of Social Medicine and Public Health, the co-partner of this campaign. This is Warsaw University of Life Sciences. The floor is yours. Ladies and gentlemen, one of very important elements of the support for refugees from war zones is to satisfy their health needs. It is also providing access to basic healthcare services, including prevention and vaccination. We wanted to answer the question and the request of the WHO not to leave anybody without care, not to leave anybody without the healthcare system. Well-designed intervention in the healthcare system should be based on evidence. Consequently, I'd like to present results of research concerning the structure and frequency of hospitalization of Ukrainian children in Poland. After the outbreak of war, we noticed great refugee crisis in Poland. We had 1.5 million more patients in our healthcare system. It concerns children in particular. We noticed that most of the refugees we hosted were children and women. These were patients younger than 18 years old. And Ukrainian children came to Poland quickly. In the first month after war, half of the children were forced to leave their country and to look for security and safety outside of their country, in the host country. The goal of our research was to evaluate the changes in the incidence of the hospitalized group, especially among refugees who came to Poland after the 24th February 2022.
Our data was from the general Polish research that was a nationwide general hospital mobility study in 2022, where the data is collected from all the general hospitals in Poland. So our analysis was based on the data about the general situation, data from the discharge documents, where we had the main ICD-10 cost of hospitalization. And we took two time frames. The first period was before outbreak of war in Ukraine, and the other one was after 24th of February 2022. The dates that we considered important were the ones related to the flow of migrations. So after January 2014, after the annexion of Crimea, there was the first wave, and the outbreak of the war in Ukraine was the starting point of our second period of analysis. 4,768 children were hospitalized in Poland. Most of them were hospitalized after the outbreak of war with Russia already. We also saw that the hospitalizations of Ukrainian children happened more frequently after that date. Hospitalizations of pediatric Ukrainian patients to Polish hospitals is as follows. Majority of them were hospitalized within first days, weeks after the outbreak of war. That was the first contact point with healthcare hospitals, and it was emergency hospitalizations with a discharge with recommended further treatment. In 2022, most pediatric patients from Ukraine were below first year of age, with a slight majority of boys. Most often they were hospitalized due to infectious diseases, and we analyzed the infectious diseases according to ICD-10, mainly diarrhea, viral and intestinal infections. Then the second reason was abdominal pain and pelvic pain, as well as fever and other unknown origin pain. We had patients also complaining from fever that was not due to unknown cause. Dominating category of this group were severe infections of upper respiratory tracts, and then injury, poisoning, and certain other consequences of extreme cases. SARS-CoV-2, well, here we had 108 children hospitalized with this diagnosis. In terms of structure of diagnosis that were the reasons for hospitalization, we noticed that many of those hospitalizations were avoidable actually, because they referred to the diseases that are vaccine preventable ones. We also noticed how the structure changed after the outbreak of war. As you can see before the first column, the main hospitalization reason were the factors impacting health, and 1/3 were the childbirth, the children were born. The second rank were the ones related to perinatal area, and the third rank was immunological and blood diseases. After the outbreak of war, the structure changed entirely, with infectious diseases and parasitic diseases going really high up to the first and second rank. And that was increased by dozens of percentage points. The second rank is symptoms and the lab test results that were out of norm, and there was a large share of COVID-19 diagnosis in hospitalized patients after the war. When we observed children with a refugee background from other countries than Poland, in 2022, we saw that the main reason for hospitalization in those two groups, children from Ukraine and children from other countries, both these groups had the same main hospitalization reason, which were certain infectious and parasitic diseases. In this ranking, the main hospitalization reasons had only the second position, but was different. The results of our research indicate the need for activity under the public health domain, interventions such as vaccination campaigns, and to act to the benefit of actually providing equal access to healthcare, which means we need to increase vaccination rate by giving people a reliable source of information and actually paying attention to children that came from war-ridden Ukraine, that their vaccination is done on time according to the calendar with no remaining immunization gaps. Thank you very much.
Dziękuję bardzo, pani dr Katarzyna Lewtak.
Thank you, Katarzyna Lewtak.
W tej kampanii były przekazy, które były bardziej
In your campaign,
mniej
did you have
skuteczne,
messages that were more or less effective? Have you got some own reflections about that?
Dr Dorotę Kleszczewską,
Dorota Kleszczewska, the coordinator of this program and the president of the Foundation of Mother and Child. The floor is
Dziękuję.
yours.
Ja postaram się już bardzo
Thank you
krótko,
very
bo
much. I'll be
wiele
very brief
treści
because a lot
dzisiaj,
was
bardzo
already
ważnych i
explained.
merytorycznych przekazów padło dzisiaj
So
z tej sceny. Ja tylko pokrótce przypomnę, mówiliśmy o kampanii, ona była efektem tak naprawdę działań, ale musimy pamiętać, bo mogli Państwo zauważyć taki dualizm i badań i działań, ale my musimy wrócić do tego lutego 2022 roku. Myśmy wtedy rozpoczęli tak naprawdę współpracę Emergency Response, tak się nazywa biuro UNICEF, z którym zaczęliśmy współpracować i to też była taka odpowiedź na coś, co się wydarzyło nagle. Więc z jednej strony musiliśmy już edukować, już prowadzić działania,
start educating and carrying out activities, and then on the other hand we wanted the projects to be evidence-based, so we were getting ready to carry out a scientific activity. First it was under a pilot by Dr. Dzielska, and then it was developed further by Agnieszka Zochoń-Latoszek from UNICEF together with Sarah Christie. We worked in two tracks. at the same time we needed all the needs to be covered in this dynamic and difficult situation. Let's remember that the children who came not vaccinated or not fully vaccinated, they were about to enter the schools and kindergartens and be at schools. We know that they were in homes and playgrounds with Polish children as well. So we took the data from a pilot study and we had our own competences in health literacy. So the strategy that Dr. Dzielska spoke about had a first purpose of raising awareness. As a foundation and as UNICEF, we focused on the first purpose because it was most doable for us. And obviously, the health literacy definition says that it is knowledge, motivation, and competence of people of how they understand and use knowledge about health. What we used on the basis of a literature review was well-grounded. Colleagues from health behavior, and they know about how higher health literacy translates into a higher vaccination rate. So we followed recommendations from literature, and that's the way we carried out our campaign that had this aim of increasing competences in terms of healthcare of Ukrainian mothers in Poland. At that time, we worked in dual mode on two tracks, indirectly addressing mothers and directly addressing doctors and healthcare professionals. I need to say here that our presence here in the region, being here in Poland as a foundation, having experts here, the people who were hired here, it was a multi-centered study. Professor Czech, who is here with us, Dr. Kindler, Professor Jackowska, who wasn't able to be here with us today. So many experts from various centers. We were able to actually reach healthcare professionals with our message, because when we were working, we saw that Ukrainian mothers, they were within their own world. So we tried to actually reach them through media that were actually in Ukraine, because they watched Ukrainian media, Ukrainian social media. They had their own groups that we are used to in Poland. So that was a very important cooperation that enabled us to actually react quickly. We worked with UNICEF in Ukraine and really get the messages through. We were not looking for a media campaign in Polish channels, but we actually worked both ways with Ukrainian social networks as well. What we did was based on three pillars: knowledge, motivation, and competences, in order to take appropriate decisions in the area of vaccinations. We made some materials available very quickly. They were first in Polish and Ukrainian, and we made them available in 6 Polish cities where a majority of refugees came to. That was comparison of Polish and Ukrainian calendars of vaccination. That was for mothers and for doctors. We provided lectures as well. We were trying to be in conferences and meetings from pediatricians, neonatologists, nurses. So we entered the Polish conference calendar and tried to reach as many people as possible. We also organized our own meetings, and I'm really grateful to national consultants of neonatology, Professor Helwig and Professor Jackowska, who was a national consultant at that time. We were invited to their meetings, and through voivodeship consultants, we also tried to spread the information as fast as possible. In terms of motivation,
dwie grupy docelowe, bo z jednej strony motywowaliśmy
We had two
mamy,
target
ale
groups.
z
We
drugiej strony
motivated
jednak musimy
mothers, and on
motywować,
the other hand, we
pracowników
really
ochrony
needed to
zdrowia o
get
tym,
the
żeby
health care
przekonywali do
specialists
szczepień, a
motivated
może
as
nawet
well
nie
to
tyle
convince about
przekonywali,
vaccinations.
bo tu mamy jakby
Not only that,
wierzymy w to mocno,
we
że ich
believe
przekonywać do tego
strongly
nie
that they
trzeba,
don't
ale żeby
need
oni przy każdej
convincing,
okazji
but
pamiętali
we
o
wanted them to
pytaniu
remember
o szczepienia, czyli czy
to
to jest
ask
wizyta przed
questions
szczepieniem,
about
czy to jest
vaccination,
złamana
whether it
ręka,
was a
hospitalizacja z innego powodu,
pre-vaccination
czy
visit
może
or
dziecko,
a
które
visit because of a
urodziło się
broken arm or a
w
child that was
Polsce,
born in
pochodzi z Ukrainy,
Poland,
a rodzeństwo przebywa w
coming
domu,
from
żeby
Ukraine,
za
and
każdym
there's
razem
siblings
lekarz,
at
pielęgniarka
home.
czy pracownik
Every time
służby
we
zdrowia
wanted the nurse
zapytał,
or
czy dziecko jest
doctor
zaszczepione,
to
żeby
ask
sprawdził,
whether
żeby
the child
zapytał
is vaccinated, to check this.
o właśnie rodzeństwo
To
i
ask
żeby
about
podpowiedział,
siblings and
też,
to
że jest to
actually
proste
say
i
that
łatwe. Więc mieliśmy
vaccinating
również
is
takie porady
easy and simple.
dla
So we had
lekarzy,
also
dla pielęgniarek,
some guidelines for
dla
nurses,
pracowników
for
ochrony
doctors,
zdrowia
for
o tym, jak
healthcare
rozmawiać z
professionals about how to talk
pacjentami, jak
to
ich przekonywać.
Ukrainian
I tutaj w tej
patients and how to
motywacji,
convince them.
sięgaliśmy również po dane
Under the
ekonomiczne,
motivation
ale
pillar,
również
we also
dotyczące
quoted
tego,
economic
czy
data,
system, co będzie, jeżeli
saying what
te
will
choroby,
happen
które,
if
o których myśmy trochę
in
już
our
zapomnieli,
system, the diseases that we
Polsce
kind of
pojawił się
forgot
na
about
dobre w
would
naszym systemie
resurface and
ochrony
reappear
zdrowia.
in our healthcare system
Jakim
again.
wyzwaniom będzie ten
What
system
kind
zdrowia
of
musiał
challenges we
się
would have
przeciwstawiać,
to
jak
face
lekarze
then, how doctors and
polskie pielęgniarki
Polish
czemu będą
nurses,
musiały w
why
gabinetach stawiać
they
czoło. Z drugiej strony
really, how would they
udostępniliśmy
need to
taką
work
wiedzę
in their offices.
psychologiczną. Nawet
We also
zatrudnialiśmy coachy, jak to się dzisiaj mówi,
employed
trenerów
coaches,
od takiej
the trainers,
komunikacji, o tym, jak
to learn
rozmawiać
people
z
about how
osobami
to communicate
nieprzekonanymi, jak
to
rozmawiać z
people
tymi,
who are not
którzy
convinced.
nie
How
są
to
przekonani
convince
do szczepień,
people
a z drugiej
who
strony
don't
to, o
want
czym mówiła
vaccinations. And
dr
on the other
Cieska,
hand,
też nie są
what
gotowi
Dr.
na tę
Cieska
wiedzę,
said,
bo oni
they were not
za chwilę
ready for
wracają
that
do domu.
knowledge
Oni
because
cały
they
czas o tym mówili. My mamy
kept
inne teraz
telling
tematy, bo my
us we have
szczepieniami
other
zajmujemy się
topics
po
because
powrocie do
we
domu.
will go
A
back
tu z
shortly.
wspomnianych już
We'll
szkoleń
go
i
back
pracy
home
nad
and
strategią,
then we'll do the
w
vaccinations.
zespole międzynarodowym
And in
wiemy,
this
że na przykład
international
uchodźcy z Syrii
trainings,
po kilkunastu latach potrafią mówić, my zaraz wracamy do domu.
We
Więc to
know
jest taki
that,
stan
for
bardzo,
instance,
jakby
refugees from
indywidualny, ale też,
Syria, after
spójny dla
several
wszystkich
years
uchodźców,
of
nie
being
tylko tych z Ukrainy. Więc tu na
refugees,
pewno ta
they
wiedza,
would also
się
say,
przydaje, żeby
in a
o niej
moment, I'm
pamiętać
going
i
back
też,
to my
żeby
country.
wiedzieć, jak
So
temu
let's
przeciwdziałać,
just
jak
be
motywować.
prepared and
Motywacja
know how
online,
to motivate
czyli,
people.
różne filmy,
Working
dostępność,
online, we
również
provided videos
zbudowaliśmy
and
po
we
naszych
really
badaniach pilotażowych, o
had
których mówiła
pilot
dr. Cieska,
studies that
wykazało,
Dr.
że
Cieska spoke
jednak,
about that
przekaz
showed
od ukraińskiego
that
lekarza,
when
od
there
ukraińskiej
is a
pielęgniarki
message
może
from
być
a
bardziej,
Ukrainian doctor or
efektywny. I dlatego
nurse,
były
it can be
nagrania
more effective.
właśnie
That's
z
why we had
lekarzami
videos
i
with
paniami
doctors
pielęgniarkami z
and
Ukrainy
nurses
po
from
ukraińsku, które
Ukraine in
motywowały i
Ukrainian to
przekonywały,
motivate and
że warto się
convince
zaszczepić,
that
podkreślały
it's worth
też to, o czym mówiła
vaccinating.
dr Karnej, czyli że
Also what
nie
Dr.
wszystkie
Karnej
szczepienia
said,
są refundowane
not
na
all
Ukrainie. Jest to też taki
vaccinations are
swoistego,
reimbursed in Ukraine, you know, that was an
zysk, że
incentive, like
mama się
profits to them.
zaszczepi tu dzisiaj w Polsce,
If
chociażby
mom gets
przeciwko
vaccinated
rotawirusom
here in
czy
Poland,
pneumokokom,
for instance
które
against
za chwilę musi
viruses
poza,
or
jako
pneumococci,
powrocie do domu zapłacić,
and
to
when
też
she
był
comes
taki
back, she would
motywator,
need to
który
pay for
staraliśmy się
those. That was a
No i
motivator
motywacja na
that we
żywo.
used as well.
Ja żałuję, że mam zdjęcia,
I-
niestety nie z
I'm
wczoraj,
sorry
może
that
w trakcie
these are not
przerwy
photos
zobaczycie
from
Państwo
yesterday.
wczoraj, kiedy
Maybe
mieliśmy rozwinięcie tego, co
you'll see them
zaczęliśmy
later.
tak
That's
naprawdę
how we
w zeszłym roku
started
i
last
w
year.
październiku tego roku, czyli
And,
wioska dotycząca
there was
szczepień
a
na
whole
naszej
village
flagowej imprezie Odważ się być
about
zdrowym, gdzie promujemy zdrowie w ogóle.
vaccines
Wczoraj była
and our
dedykowana
event that
edycja
we
poświęcona
have to
wyłącznie
promote
szczepieniom
health.
z bardzo dużym udziałem
Yesterday's
Światowej
event
Organizacji
was
Zdrowia,
really focused
UNICEF.
on
Ja mogę powiedzieć, że jak
vaccines
rozmawiałam z
with
dziećmi,
World
uczestnikami,
Health
to mówili,
Organization, with
najlepsze
UNICEF,
gadżety,
and
najlepsze gry, więc widać, że rzeczywiście
children
jesteście
would
bardzo do
say,
tego
"You have the best games, the
przygotowani
best
i musimy
gadgets,
również
you
w
are
tym
well
duchu
prepared.
podążać,
We need to be
żeby
prepared
tak
to follow
atrakcyjne
this spirit and to be
edukacje
really
prowadzić
attractive
również dla
in
tych
education
najmłodszych.
that we provide
Ja
to
bardzo
youngest
dziękuję,
children.
bardzo
Thank you very
dziękuję
much.
również za
I'm really
udział, za
grateful
wszystkie wystąpienia i
for
myślę, że
all the
podsumowanie
presentations that we
zrobimy
heard.
pewnie w panelu.
In the panel discussion, we'll have a summary.
Dziękuję bardzo Pani Doroto. Proszę Państwa, teraz
Thank you.
przechodzimy do takiej części właśnie
Let's move
podsumowania.
on to a summary
Się trochę
now.
przeorganizuje ta przestrzeń.
The space here will be
Zapraszam
reorganized.
Państwa do pozostania
I
w tej
invite
sali,
you
bo
to
to
remain in
potrwa
this
dosłownie kilka
room.
minut.
It will only take a few minutes.
a jednocześnie chcę
And at
Państwu
the same time,
powiedzieć,
I
o
would
czym
like to
będzie ten
tell
panel.
you what the
Będziemy
panel
tutaj,
will
to
be
będzie
about.
podsumowanie właśnie, tak
That
jak
will be a
powiedziała pani
summary,
Dorota.
as
Będziemy mówić
Dorota
o
said.
tym, w jaki
So
sposób
we will address
skutecznie
the
obalać
matter
mity
of
dotyczące
debunking
szczepień.
myths about
Jak
vaccinations, how
wypracować
to do it
zaufanie
effectively,
do
how to
szczepień.
build
Jak
trust to
wypracować taki
vaccinations,
wspólny,
how to work out
jednolity
a
przekaz,
joint
który po prostu będzie trafiał do jak
coherent
największej
message
grupy
that
osób,
would
który
be
przekona tych nieprzekonanych.
directed at
Także bardzo
people who are
serdecznie
not
zapraszam za
convinced
chwilę
yet.
tutaj w gronie
So in a moment,
ekspertów,
we'll have an
których
expert
też za chwilę
panel.
zaproszę.
And I'll invite our panelists in a
Można sobie w tym
moment.
czasie wziąć
You
coś
may
do picia, są
have
bardzo
a
dobre
coffee
przekąski.
or really nice
Ale
snacks.
zapraszam, żeby
Please
Państwo
get
pozostali z
back
nami.
here and be with us.
Fundacja Instytutu Matki i Dziecka od 10 lat promuje zdrowie, promuje profilaktykę chorób zakaźnych, w tym również szczepienia rutynowe. Dzisiaj była to impreza na wesoło, rodzinna. W dniu jutrzejszym wykłady, rozmowy naukowców, debaty, więc dalej w ramach Międzynarodowego Tygodnia Szczepień będziemy rozmawiać o zdrowiu i o tym, jak najskuteczniej przeciwdziałać chorobom zakaźnym właśnie poprzez szczepienia.
So it's so exciting to be at this great event here today, bringing together children and families from Poland, from Ukraine, a chance to socialize, a chance to exercise, a chance to run, and all in the service of a great cause, which is trust in vaccination.
Gdzie można się dowiedzieć wszystkich potrzebnych informacji. Pamiętajcie Państwo, że szczepienia to jest największe osiągnięcie XX wieku. Uciekiniom przestało ubierać niemowlęta.
Z całego serca dziękuję, że przyszliście, że chcieliście wziąć udział w pikniku rodzinnym pod hasłem Zaufaj szczepieniom, bo to znaczy zaufaj medycynie opartej na dowodach.
Temat szczepień niezwykle ważnym i niestety w ostatnich latach obserwuje się taka tendencja, że w Polsce ten poziom wyszczepialności trochę się obniża i z tego powodu obawiamy się, że może dojść do tego, że poszczególne choroby, których tradycyjnie tutaj nie było wiele albo nie było wcale, jednak się pojawią. I z tego powodu chcemy poinformować społeczność, poinformować rodziny, dzieci, że szczepienia są niezwykle ważne, że to jest efektywna, skuteczna metoda zapobiegania chorobom zakaźnym.
Ladies and gentlemen, I would like to welcome you back in the third part of our meeting. And this time we are going to summarize everything we have heard already, and we've heard lots of valuable information today. I'd like to repeat some of them. How can we develop the most effective message? How to reconstruct trust in vaccination? How to rebuild it anew? Maybe we need to look for new messages, new communications. Maybe it should be simplified even more or addressed to more to better defined recipients. We would like to discuss such messages here, and I'd like to introduce our participants in the debates. Dr. Mark Muscat, Regional Office of the World Health Organization from Copenhagen, Regional Office for Europe. Dr. Marcin Czech, Institute of Mother and Child in Warsaw, Dr. Dorota Kleszczewska, Institute of the Institute of Mother and Child Foundation Board, Dr. Aaron Gashi, Health Expert, UNICEF Central and Eastern Europe Regional Office, UNICEF Refugee Response Office in Poland, Dr. Alicja Karni, Deputy Clinical Director, Mother and Child Institute, Dr. Joanna Kujawa, Ms. Joanna Kujawa, Head of Environment Health Division, Department of Public Health, Ministry of Health. And we are in an organizational outfit. This is today's uniform. We'll start with Dr. Mark Muscat. I will speak Polish, and the interpretation is provided, so consequently my voice will be heard in English and in Polish.
Dziękuję bardzo. That's as far as I can get with
Thank you very much. Dziękuję bardzo. This is all I can say in Polish.
It's a very valid question. Is this okay? Can you hear me well? Yes. Okay. It's a very valid question. And to go back about the messaging and how to build confidence, we heard earlier today from the speaker.
I think you should take off your phone.
No, okay. We heard earlier today that there isn't just one single message that can be said. I think the message has to fit the concerns. So if there are different concerns in different populations, then the message has to be tailored to address those issues. Excuse me, I just need to switch this off. Yeah, I think it's off now. Okay, thank you. Yeah, so having the most important information on vaccines, on the benefits that they provide, coming from reliable sources, I think is one major step forward in building trust in the communities. So science, evidence-based information, and also coming from reliable sources. Unfortunately, in this day and age of widespread social media use, we get information from sources that may not be reliable. And we believe what we think is right, because we do not fully understand the benefits of vaccines, we don't fully understand the science that goes behind it. So we can only reach conclusions based on what we think, what we understand. And if there is a social media channel that is promoting or demoting actually vaccines, saying, for example, that they cause major problems, or maybe they say that this is all for the pharma, because they want to make money. When you hear these kind of things, you need to have the right information on why the vaccines are being used. And therefore, having the right information coming from the reliable sources. Now, we heard that, luckily, Doctors and nurses and the healthcare professionals in Poland are still trusted sources. We need to equip further the knowledge that the nurses have, that the doctors have, starting from when they are medical students, when they are nursing students. So the introducing or strengthening already topics of vaccination, vaccinology, about the vaccines and the diseases they prevent, even at that stage, so that the future doctors and nurses will be able to confidently talk about vaccines, convince the parents that if they have any doubts, to allay their fears, and therefore that's one other way of how to build trust for vaccines.
Thank you. And I would like to ask Dr. Argon Gashi. Yes, in English, I will try. I will try in English. Vaccine for every child, it is your main message. What is your contribution? How do you help different organizations in Poland also to realize this mission?
Thank you very much for this question. Before I start, I just want to use this opportunity to thank all organizers for this great event, which is a momentum that we also celebrate what we achieved. And as we know, this year is also commemorating or celebrating the expanded program of immunization of 50th anniversary. And then we also note how many lives they are saved. In that process, this is also momentum that we also appreciate health workers for they tireless and working day and night to ensure that we also benefit from health services. In this aspect, is also momentum to appreciate parents because this process is successful and in partnership with partners. As you know, UNICEF is mandated to support and to advocate for children's rights. And this process, UNICEF is working closely with governments, with donors, and with partners such as WHO. So we advance, we also engage to the common or the shared goals, and we ensure that children have access to live vaccines or they are protected from child vaccine preventable diseases. So there is evidence, and we heard today, and thanks to presenters for bringing such valuable evidence, which is again reconfirming that we should continue our efforts systematically so we can maintain, we can evolve that trust between health workers, between partners, between system, so we make and we celebrate more successes. So this is a long journey and it requires again additional efforts, and this debate, this partnership, this presence, it shows again a signal that we have to convey together messages so we can involve, we can engage parents, we can engage families, we can engage health workers, so we make sure that children are protected from vaccine preventable diseases. In terms of the contribution, and colleagues I mentioned already during emergency, especially emergency, one of the key interventions that UNICEF jointly with WHO and other organizations is vaccination, because those children are vulnerable, moving in places which are affected by different environments. So vaccination is the first intervention so we protect their lives. In addition to that, there is a continuous process of working with partners, with governments, and we heard already from head of UNICEF Refugee Response Office in Poland, but also from colleagues, what is the contribution of UNICEF in Poland so we can support, we can protect children from Ukraine from vaccine preventable diseases, but as well other children. This is, in addition to that, just to share with you that, and thanks to Mark for presenting a very insightful presentation about the situation. So we also regularly monitor what is the situation, and we can bring evidence that how we can support, in this case, partners, and then we reach those which are left behind. So equity is a very important and one of the key words which was mentioned by colleagues. And lastly, as this is the process which is requiring systematic engagement into the governance, into the partnership, into the service, into the working with communities. Just to highlight that UNICEF is also supporting governments in procurement of vaccines. And according to the global engagement, which means that over 45% of children, they are covered with vaccines which are purchased or they are procured through UNICEF supply mechanism in support to government. Thank you.
Is Poland specific? Is Poland what is the difference between Poland and other countries from Central Europe, for example?
Thank you again. As you know, UNICEF Refugee Response Office was started to function from March 2022 as a response to the situation which was evolved in Ukraine. In addition to that, just to also mention, there is also an outcome office which are part of the program to advocate and to support, but also to generate resources. Now, in that response for refugee, UNICEF was advocating, especially with social behavior change. This is how we call it, the team. So we can hear also parents, what are their barriers and how we can engage them so they can vaccinate children. In addition to that, there were also interventions, and one of them was mentioned by country coordinator, that with Ministry of Health leadership, we have supported access to primary health care. So through primary health care, so children, they can benefit from services. At the same time, they can also be reminded or supported for vaccination.
Thank you very much. Ministerstwo Zdrowia zostało tutaj, że tak powiem, wspomniane. Co robi
Ministry of Health was mentioned here. What is Ministry of Health doing in Poland in order to increase the immunization coverage, vaccination coverage in Poland? Do you have your microphone? I don't want to give away my microphone.
Jakie są działania?
Please, can you tell us what are the activities?
A teraz działa? Szanowni Państwo,
Ladies and
w
gentlemen,
sumie temat, który związany jest z zwiększeniem wyszczepialności,
the subject touching on increasing immunization coverage has been monitored at the national scale for many years.
bym powiedziała, takie delikatne.
Previous needs in this respect were not strong, I'd say. They were delicate. Promotion was important, access to information was important. But for some time we have noticed that vaccination requires our presence in social media. Information related to health, to medicine, requires higher level of communication. It requires our voice among parents, but it requires us to broadcast this voice in a different way. Therefore, recently we decided to start promoting the source of knowledge for all the interested parties in this difficult period concerning war conflict in Ukraine. We want to secure the information in the portal Szczepienia Info that would be translated into vaccination info. This portal has been created for our citizens coming from Ukraine, and information there is in Polish, Ukrainian and English. We want to increase access to information concerning to vaccination and contagious diseases, and the most important messages, and also to information from worldwide reports, from global reports. We want to offer access to reports concerning patients prepared by ECDC and WHO. This portal has connection to all the campaigns and information which is also presented today and discussed today here. This is a very reliable source of knowledge which is aggregating all the information for the realization of vaccination campaigns, for the verification of knowledge, and all this information is made available to every citizen in Poland. This is our key goal. We want to collect knowledge concerning vaccination and publish it in the most, in the simplest way possible. We also provide adequate graphics to make it easy to understand and easy to use in nurses and doctors' everyday work. This is the first step we made a long time ago, but it requires further development. The Szczepienia Info program is very specific in terms of the scope of information. We may say it is a portal that moved out of portal. Social media was Facebook and Twitter and all the channels available. Right now, every citizen can benefit from it on their mobile phone. Many articles and leaflets are adjusted to the conditions we have in our everyday life. So we have the QR codes that can be downloaded, and content can be downloaded through QR codes. It is easy to access, easy to verify. Quite often, materials are accompanied with addresses, links, phone numbers, so that every person looking for information has the access to it directly. So we are open. We offer information to general public. There is another scope, which is more medical. This is the IKP, the Internet Patient's Account, and there you can find your information concerning your medical visits and referrals, as well as prescriptions. It concerns the parent and the child, and you can reach protective vaccination there, and you will be able to learn all the dates concerning the obligatory vaccination calendar on this internet account of Polish patients. So you can learn about advised vaccination and obligatory vaccination. We have a classical booklet, vaccination booklet of a child. It is in the paper form, and we also we have put it into the internet patient's account. This is a part of the website account, internet account, which is going to be further developed. Later on, our citizens, our parents and children will have access to information concerning vaccination on the internet account. This information will be translated into factual vaccination. Since October, all the obligatory vaccinations have been moved to a reporting level where the medical staff reports the vaccination performed in medical documents. The plan has become a duty. It has legal framework. Parents and health care staff are subject to legal framework, and information concerning the realization of protective vaccination is connected to reporting. This information has been updated, and it has been transferred to the Ministry of Education and to the Center of Formation of Medical Staff. So this information is functioning at the level of education for doctors and nurses and other medical staff. All right, I will try to shorten the next part of information I wanted to share with you, because time's running. When we promote vaccination, we add further additional competences of medical staff.
Też osiągnęły taki poziom, kiedy do kwalifikacji osoby dorosłej ma prawo nie tylko lekarz.
We have recommended vaccination, and a nurse, midwife, paramedics can also qualify for recommended vaccinations. The adult patients, they have such capabilities right now. Vaccinations moved into another stage of further realization of such services. The Ministry of Health wants to reach the target of increasing the share of vaccination in the population, but we also want to be closer to our patients and our citizens, especially those who want to benefit from it, and those that require more information. Another element which is important here, in case of information campaigns, is broad cooperation with all the stakeholders, with all the institutions which are working on the vaccination subject at various levels. They want to help, they want to notice the problems, they want to solve the problems, and they focus on solving such problems thanks to any tools available on the internet and behavioral research leading to understanding the patient, the person. We have another project realized in a consortium of several institutions, and I encourage you to go to a MedFake website. There you can get information concerning protective vaccination, but not only. There are also analyses concerning the situation we have right now. The situation concerns our country and our population. We have materials there well prepared concerning trainings and how to change attitude towards vaccination. It is for all of us, so that we're not afraid of vaccination. It is for all of us to rather be afraid of contagious diseases. Right now we can see that this tendency is, I should say, the other way around. So counteracting this tendency is crucial. In short, the most important activities have been mentioned here. I have already described them. These are the activities that are important from the point of view of the patient. We also have some space for systemic change. We do it through step-by-step attitude. We are improving access to vaccination, but we also need to know what is the reality. We have certain changes, but we want them to be translated into increased share of vaccination coverage in the population. Thank you very much.
Thank you very much. You mentioned what is being done for patients. I'm wondering now, doctor, from the point of view of a doctor, what information does a doctor need when there is a mother or a parent coming with a child to the office? What do you need? From a pediatrician's point of view, a person who has been dealing with children and vaccines on an everyday basis, what is missing is information. I'm really glad to hear of all the changes. Doctors actually dream of having documentation of patients when they can see what a person is vaccinated against. We don't have that yet, unless a parent brings the booklet, a card, a vaccination card, but the patients are often without the problems. When a parent comes with an infection, they don't have a vaccination card. And I've been working 35 years, but I have also asked in every visit, I ask about vaccinations. I have a routine of doing that, a habit. If a child comes for a different reason, this is missing. I don't have an easy access to vaccination information. It would be facilitation. It really would be easier, because when I have a history of disease and I have a history of vaccination, I can have a conversation with a parent that is more precise. There are many consultations that assist in setting an individual calendar for vaccinations for children with chronic diseases. In Warsaw, there's one single place, and it would be wonderful to have more places like that. We as Institute, we have been thinking about it for many years. We don't have a place for it, but we will create this vaccination point for children with oncological or other chronic diseases, so that we can inform parents of how the calendar would look like for this child, but also to make appointments and get the child vaccinated. Well, education needs to start early in the kindergarten, where children are explained in a very simple way what vaccinations are and what they are from. And my experience is that children bring the information home. Even if parents are opposed, child often comes and educates the parents already from a kindergarten level. So that's a very good starting point for education.
A jak pani, jak to się robi w Instytucie Matki i
In
Dziecka?
the Institute for Mother and Child, how do you do that? What do you do actually to increase the awareness? The patient's awareness, people who come here who use your help. Obviously, our patients and the majority of those children have chronic diseases, and they come to the institute often. And with the many visits that they have, we also talk about vaccines when they leave the hospital or when a child is born. Then we educate the mothers. We educate the staff as well. I need to tell you that an achievement of ours was to get all the staff vaccinated. I mean, 99% of healthcare personnel is vaccinated against COVID. So the education that we did, and we talked to our staff, telling them how important it was. So it brought results. We organized a vaccination point for our employees. It matters a lot because we may talk, but if there's a difficult access to vaccines, then it brings entirely different results. Professor Marcinczak, how do you do that, taking your perspective on the scale of an institute, that's a micro scale? How to improve the effectiveness of the vaccination? Well, I wanted to tell you about a more broad context, but you're asking me about micro perspective. Okay, then we had quite extraordinary success. We had 93% vaccinated people, but 4% who had actually counterindications.
97% wyszczepionych osób przeciwko COVID-19 w tej pierwszej fazie, co jest chyba rekordem Polski.
Vaccinated in the first wave.
Jak to się robi?
How do you do
no
that?
więc myślę, że to są działania na wielu płaszczyznach. Po pierwsze, trzeba mieć leadership, czyli trzeba mieć dyrekcję i menadżerów szpitala, tych raportujących do dyrektora, którzy chcą to zrobić, którzy podejmują decyzję, będziemy zabezpieczać nasz personel. Szczerze mówiąc, pamiętam do dzisiaj moje spotkanie z dyrektorem szpitala, który powiedział, wiem, że masz dużo zainteresowań, ale teraz masz tutaj telefon, masz tutaj laptop, jesteś podłączony 7 dni w tygodniu, 24 godziny na dobę, nikt mi ma nie umrzeć na COVID-19 w moim szpitalu. I to rzeczywiście się udało. Myśmy mieli jedną hospitalizację jednej ciężej chorych osób z personelu, a tak udało nam się wszystkich ochronić, między innymi przez
COVID, but everybody else, all the other people in the healthcare staff were protected. We had also, of course, the barrier kind of protection in the foundation helped us a lot. There was a problem with everything back then.
Kombatanckich opowieści
I'm
snuć,
not
ale
going to get into the stories, but you all know
Także
what
zaczęliśmy
I'm
od
talking
decyzji.
about. So
Potem
the first thing was the
bardzo ważne
decision.
było
The
szkolenie
next one
ludzi, czyli
was
żeby
the training,
informacje
which was
dotarły w sposób
very important. So we wanted
zorganizowany
information to
do
be given in an
personelu, bo
organized
przecież
way.
my nie mamy tylko białego personelu,
we have
któremu
not
wystarczy
only
tam mrugnąć okiem i oni sobie doczytają, bo to są
color
lekarze,
staff,
ale to jest
and
również
we'll just mention something
inny
and they'll
personel.
read about
Mamy,
it. We have other
poprawnie,
stuff
ale jeśli
too.
się mylę, około 1200
Correct me if
osób
I'm wrong, we have
zatrudnionych. I to są osoby z
1,200
bardzo
people
różnym
were employed, and
wykształceniem, z bardzo
their level of
różnymi poglądami
education and their opinions are really
Pierwsza rzecz
diversified and so
to
on.
są szkolenia.
So trainings
Kolejna
is the second
to jest
thing, the
włączenie
third thing
niejako
is
personelu w te wszystkie
to
działania.
have
My
the stuff
zrobiliśmy tutaj
included
takie
in the
badanie.
activities.
Nie
So
było to
carried out
proste,
a
ale jakoś
study
nam się
which was
udało
not
w formie
actually
elektronicznej,
easy, but we
dziękuję
made
IT,
an
i w
electronic
formie,
survey,
w
and I'm
formie
grateful to
papierowej, gdzie
IT
ludzi
guys.
pytaliśmy po prostu,
We also had a paper
czy oni się
questionnaire
szczepią,
and
czy chcą się
asked
zaszczepić,
people,
czy mają
do you get vaccinated? Do you
pozytywne
want to get
nastawienie,
vaccinated?
czy
What
mają
is your approach? Is
negatywne,
it positive? Is
czy
it
zamierzają się nie
negative?
szczepić, a jeśli
Do
to,
you
to
intend
dlaczego?
not to get
Czyli,
vaccinated?
staraliśmy
So,
się jak gdyby
why?
zejść na
So we tried
samo
to get
dno
to the very
podejmowania
bottom of
decyzji,
the
czy na
decision
tą
making,
samą bazę.
to the very base
I tutaj
of it.
uruchomiliśmy
And
punkty
we
odpowiedzi na pytania wszelkiego rodzaju. Czyli do mnie
where
można
you
było
could
zadzwonić w zasadzie
answer
cały czas i zapytać, czy jak ja
any
przyjmę tą
answer.
szczepionkę mRNA, ona
So
jest tam ze
if
zwierzętami jakoś, to ja, czy
somebody
ja się
had
zamienię
doubts,
w nietoperz.
they could ask
Ja
me if I
bez
get the
wyśmiewania takiej osoby
mRNA, will I
odpowiadałem,
get
że się nie
transformed into a
zamieni.
bat? And
Albo
I
też,
didn't laugh at
pamiętam,
such a person.
zadzwoniła taka
I would
pani
just
i mówi,
calmly
no ja
say
się nie
that
szczepię,
they
bo
would
ja mam
not.
mamę chorą,
A
leżącą
woman told me, I don't
w
get
domu, ja
vaccinated
się nią
because I
opiekuję
have
jako
a
jedyna
sick
osoba,
mother.
boję się,
I'm
że
the
jak się
only person
zaszczepię,
who takes
to
care of
wtedy
her.
przyniosę
And
ją
I'm afraid
jej
that
tą
if I get
chorobę.
vaccinated,
Wystarczyło
I'll
jej
bring the
powiedzieć, jaki to jest typ
disease to
szczepionki.
her.
I że nic takiego nie nastąpi. Potem ona jeszcze dzwoniła i pytała, czy ma tą mamę szczepić. I usłyszała ode mnie, że nie. Czyli to też nie było tak, no bo ona się z nikim po prostu nie spotyka, tylko z zaszczepioną córką, więc
you don't need anybody but a vaccinated daughter, so you don't need
logicznie wyjaśniając do samego końca, taką mieliśmy strategię. Potem, tak jak mówiła pani dyrektor, mieliśmy uruchomiony punkt, gdzie osoba mogła się zaszczepić. To w ogóle jest chyba recepta, jeśli chodzi o szczepienia dorosłych. Jutro będziemy o tym rozmawiać w Państwowym Zakładzie Higieny. Wydaje się, że po prostu osoby powinny być szczepione we wszystkich miejscach, gdzie podejmują decyzję o tym, że się zaszczepią pod wpływem na przykład profesjonalisty medycznego,
so
nie
if
tylko
there's a
lekarza, ale
healthcare
właśnie
professional,
położnej,
like
czy pielęgniarki, czy też
midwife or a
farmaceuty. Ja
nurse
się
or
bardzo cieszę, że
pharmacist,
farmaceuci w ogóle
they should be able to immediately vaccinate this person. And I'm really happy that pharmacists were allowed to vaccinate adults. And I also contributed to the change of law together with the Ministry of Health. And now pharmacists can vaccinate people. So we succeeded on a micro scale. And I'm sharing my experiences. We're preparing a publication about it to actually share our success with public opinion. We also looked at other things. There are certain strategic moments, drug policy, other strategic documents tell us how to organize the vaccination system. And, you know, viruses don't respect country borders, so that's important to be taken into account. In the documents, it's all there. I guess the implementation stage is where we need to realize where the weak points are. And if I may continue, I would like to share one more thing. Now we are coming to an end with a project that will have a publication in Vaccines too. It is about a functional approach to pathways and decision-making of
pomysłu
how a
albo
vaccine
pewnej
from
fazy rozwoju ma
certain
trafić do samego
developmental stage
pacjenta,
is
gdzie
to
on ma być
get a
zaszczepiony.
patient
I mamy
who's
funkcjonalnie
about to be vaccinated. So we
przeanalizowany
need
ten
a
cały
functional
przebieg
analysis
podejmowania
of the
decyzji
decision making around vaccine, from the registration, horizon scanning, to see what vaccines would be available in the market, through initiating the process of financing them from the public finances, reimbursement, evaluation by the Agency for Health Technology Assessment, initiation of the vaccination campaign, and how it goes through all the steps. So I invite you tomorrow, right after the conference in the Polish Institute of Hygiene, there will be a panel about communication around that project. Most important people in terms of national consultants and presidents of associations related to vaccination in in Poland will be there and will show you what are the weak points and strong points. Can you give us at least one
Oczywiście,
strong
że
point?
tak.
Oh yes, of course.
W Europie
For instance, in
mamy
Europe,
rejestrację szczepionek, która jest centralna.
there's a central
W związku z tym te
registration of
szczepionki,
vaccines.
dość szybko po zatwierdzeniu
Thanks to that,
dokumentacji
after being
wchodzą do
approved,
systemu. Mamy
the vaccines
przynajmniej
enter
dwie
the system
ścieżki,
relatively
kalendarz
quickly. There are
obowiązkowych szczepień
two
ochronnych i
pathways.
szczepienia dla
There's
dorosłych, które idą
obligatory
ścieżką refundacyjną
vaccination calendar for
z oceną
children
HTA.
and
Mamy
for
mocną
adults.
ocenę HTA
There's a strong
w Polsce.
assessment,
W związku z czym jest
HTA,
wiele
by the
jasnych
agency in
punktów
Poland,
tego,
so there are
tego
very
całego
many bright
obrazu.
points in
Ale
the whole
jest
picture.
wiele,
However,
punktów, które nie są
there
wcale
are
takie
points
jasne.
that are not so
Na przykład,
bright.
jak już
For
rozmawiamy o
instance,
tym
now that
szczeblu
we're
wyżej,
talking about the
czyli rozważaniach
level
na
that
przykład
is
europejskich.
higher
Ja
in the
w
European
zeszłym tygodniu
considerations, I've
spędziłem bardzo
spent
owocnie 3 dni w Lovran
3
w Chorwacji
days
podczas
in
konferencji, gdzie ekonomiści
Croatia,
ochrony
where
zdrowia
economists for health
rozmawiali
protection spoke
między
about
innymi o European Pharmaceutical Package, Joint Clinical
European
Assessment,
pharmaceutical
czyli temu,
package,
jak
joint
Europa
clinical
wspólnie
assessment,
może
so how Europe
podchodzić
can
do
approach the
decyzji
health matters and
finansowania
financing
leków
decisions for drugs together.
I marginalnie tylko rozmawialiśmy o szczepieniach
We
ochronnych. A moim zdaniem
marginally
powinniśmy rozmawiać
mentioned
dużo
vaccinations,
bardziej
and in
o
my
tym, bo
opinion, we
cała
should speak
idea,
about them much more, because the whole
na
idea
przykład wspólnej oceny
of
efektywności,
joint
czyli
HTA,
assessment,
joint
powinna
clinical
w
assessment
szczególności
should
dotyczyć szczepień,
particularly
bo bardzo
pertain to
szybko mogły
vaccines, so
trafiać
that they can
na
go
biurko ministra
very
zdrowia,
quickly to
mojego
the desk
następcy,
of
który
the Minister
będzie
of
oceniał,
Health,
czy warto to finansować ze źródeł publicznych,
that
czy nie.
would evaluate whether
Natomiast,
it's worth being financed
natomiast
from
to, o
public
czym
sources
tutaj głównie
or not.
rozmawiamy, no to już
And
jest ten
what we're
ostatni element, czyli jak
debating
dotrzeć z informacją
now is the last
do
element.
rodziców bądź do
How
osób
to
dorosłych,
get with
które
information to
decydują o
parents, to
szczepieniach.
adults.
I tutaj już kończę.
And
Też zgadzam
let
się
me
z panią
finish.
dyrektor Karnej, że
I
nasze
agree
działania
with Director
powinniśmy
Karny.
zacząć od takich
We
małych
should
dzieciaków.
start
One
with
są
the very
niesłychanie
small
wdzięcznym,
kids. They're really
wdzięcznym
great to
materiałem,
talk to,
jeśli tak
and
mogę powiedzieć,
they're a wonderful
bo
material to
naprawdę
actually
interesują się wszystkim. Ja pamiętam
talk
w
to.
szkole swojego
They
dziecka, które
get
jest
interested
otwarte na
in
właśnie takie
everything. I
szkolenia.
remember
I
my
pani
child when
powiedziała,
they were in kindergarten,
doktorze, to tak
and somebody told
20
me,
minut do
doctor,
pół godziny,
just
potem one
20
się
minutes
znudzą,
to half an
zadają
hour.
jej półtorej godziny pytania.
Then they get bored,
Wybierały
and
sobie
children
swoje ulubione
continued
bakterie.
for
Potem-
1 hour and a
potem
half.
jak
They had
z
their
nimi
favorite
walczyć.
bacteria,
W ogóle
their favorite
impreza
ways of
była
combating
naprawdę
those
24
bacteria.
fajerki.
We had
Także,
like a
i
great
młodzież,
party
która
together.
jest w
Young
szkołach
people
podstawowych, która
in
jest w
elementary
liceach,
school
podejdzie
and
do
high
tego
schools,
inaczej,
they would have
ale
a
równie
different approach, but
entuzjastycznie. Trzeba
equally
to po prostu
enthusiastic. You
zrobić.
just
Jeżeli-
need to do it.
Trzeba to umieć zrobić,
You just need to know
ale,
how to
ale
do it.
cieszę się, że Ministerstwo
And
Edukacji
I'm
to
happy
dostrzegło.
that the
Wczoraj
Ministry of
na,
Education noticed
imprezie,
that.
na której niestety
Yesterday
nie
in the
mogłem
event,
być, uczyłem,
I
na
couldn't
Politechnice
attend,
Studentów.
unfortunately. I was
Była i
lecturing.
minister zdrowia,
There was
i
Minister of
minister
Health, there was
edukacji.
Minister
To
of
bardzo
Education as
dobrze
well. And
rokuje,
that
bo to
gives
są te
a
dwa
very
ministerstwa,
good
które są
bright
kluczowe
signal, because
absolutnie
these two
w tym,
ministries play key role
żeby tutaj działać, żeby te informacje przechodziły, żeby one były
and
łatwo
really putting
dostępne,
information through, making it
żeby
more
finansować w
available.
odpowiedni
And also
sposób
to
szczepionki, bo to
finance
też jest ważne.
vaccines in a particular way, because that's also
żeby
important.
zarówno
And
Polacy, jak
also
i uchodźcy mogli w swoim
the
własnym
Polish
języku o
people
tym jak
and
najlepiej
the
przeczytać,
Ukrainians
zdecydować
or
o tym, żeby się
the other
wprowadzać
refugees,
bo już kończę
so
naprawdę,
they
bo nie mamy
read about
wiele
that in
takich
their own
schorzeń,
language.
przed którymi się
There are
możemy
not many diseases
zabezpieczyć,
that we
w sumie dość
may be
niewielkim
protected
kosztem
from
różnego
with
rodzaju,
relatively
a
low
jest
cost.
mi niesłychanie przykro, że,
And I
że
feel
tego nie
really
robimy.
sorry
Było
that we're
naprawdę
not
ostatnie
doing it.
zdanie,
And my
jak
very last sentence,
będąc epidemiologiem i
being an
widząc, co się dzieje
epidemiologist,
podczas pandemii
and I
COVID-19
saw what was
i
happening
patrząc na 200
during the
tysięcy
COVID
dodatkowych
pandemic,
zgonów, ja sobie wtedy naiwnie
200,000
myślałem,
deaths.
że wszyscy się
I was naive in
zaszczepić.
thinking that
I że już nie
everybody
będę
would
miał
get
żadnej roboty.
vaccinated, that
Tymczasem
I would not
obudziło
have
się
job.
tyle bestii
But so many beasts woke up.
proepidemicznych,
So many
że mamy
pro-epidemic
coś. Dziękuję
people woke up, and we
Dziękuję.
really
Ja
have
dodam, że partnerem dzisiejszego spotkania
job
jest
to be
również
done
Ministerstwo
still.
Sportu i Turystyki, więc jest
Our
kolejny
partner today
partner
is the
Bardzo
Minister of
przepraszam, bo to
Health
jest
and
też bardzo
Tourism.
ważne w prewencji pierwotnej,
Pardon me,
bije się w
in the
piersi.
primary prevention, it's also
Też się
hugely
cieszę, że to
important,
ministerstwo
and I'm really
Bardzo
happy to have that
dziękuję.
ministry too.
Mówił Pan o
Thank you.
przekazie do młodszej
You spoke about the
części naszego
messages for
społeczeństwa,
younger part
a
of
w
our
przekazie do tej
society.
starszej, czyli do rodziców.
And what about
Jaki
the
przekaz?
parents?
Budujący czy
What
straszący,
message
pani
could you
Doroto?
give? Could
Bo
you
pani ma do
actually
czynienia z tymi przekazami,
scare
a ja
them
cały czas
or
szukam
actually
odpowiedzi,
encourage
który
them?
przekaz
I'm still looking for an answer. Which kind of message would be more effective? Well, to respond to your question, compared to what Krista Z said, she was not surprised by our behavioral intervention. It's the strength of this project that we were still having to check which messages actually work. I've been dealing with health communication for years, and I was convinced that we would rather go for positive messages and they would be more effective. Talking about availability, trust to Polish healthcare. I'm talking about Ukrainian mothers. And now here, it was more about the risk and also giving a possibility of acting to mitigate the risk straight away. So it is a change after the study that we've made. When I told you the short summary, we had 2 stages of the project. A very quick response to a situation that happened right after the war broke. And today, then we had a really large randomized study to draw conclusions, and we know how to have this communication done in a more effective way. And that's one of the key conclusions. We need to scare people a little bit and show them how to minimize the fear. If I may comment.
Thank you very much. I have one thing in my head right now. In the beginning of March, that was the beginning of the whole situation we had to face. And I remember I had a phone from the Institute of Mother and Child. That first childbirth is starting, childbirth is starting, and we might have problems with vaccinating children. And I remember all the leaflets and materials in Ukrainian. The first summary of the verification of the Powiat sanitary inspection from childbirth and the state of vaccination of children. The first report was very positive for me because the state of vaccination was 95% in terms of hepatitis type B, 94% for tuberculosis. But the remaining children, that was the level just after the birth when vaccination was delivered. However, the remaining children were waiting for the decision concerning further vaccinations, and these were not refusals. And I'm talking about the situation of women from Ukraine which gave birth in Poland because they were relocated to Poland and they had to give birth to their child in Polish. Later on, the data was verified, and out of 6,000 births, the state of vaccination was not dropping, it was increasing. Now we are going to verify further data. We do not have it in electronic vaccination sheet, but some of this is already reported by the doctors. Activities from the level of healthcare staff, when vaccination is offered free of charge, when we have information and the realization of such services is simple and regular, and this is delivered on a regular basis. I just wanted to mention that in the context of what you said, the level of vaccination coverage among children just after birth shows that this population can be vaccinated, and then they are discharged to their homes, and that was what we have talked today about. It's difficult to encounter them again in our healthcare system. When they are discharged from the hospital, they are again under the remote protection of their Ukrainian healthcare service. And we are preparing further steps of our strategy in order to verify where we can meet those mothers again, because the doctors we can see patients that are coming to the doctor, and if there is a lady who uses healthcare system in the Ukraine but is living in Poland, will buy the medicine in the Polish apothecary. So Polish apothecaries, maybe Polish pharmacies, may be a good touch point in this
discussion. Just want to mention a few. Communication. I think all health authorities, including institutions, for example, should have at least one person who is knowledgeable about vaccines and able to communicate messages regarding vaccines. Sometimes it happens that there is an incident in a child that is vaccinated and then afterwards has a neurological disorder, for example. And it's a casual association, but as soon as the public learns about this condition, this child, for example, developing a disorder, they attribute this disorder to the vaccine. A communication officer will be able to allay any anxieties and search for the answers. And very often, almost always, there is no association, but in the minds of the public, this is what they perceive. And this is a way how trust is eroded. If the health authorities, the Ministry of Health, the institutions, PSH, GIS, if these institutions are not equipped with professionals in communication to deal with vaccines and the benefits, and to deal with the topic of vaccines, I'm afraid that you are giving room for distrust in vaccines and also in the authorities. That's one point about communication I wanted to mention. The other thing which was brought up is regarding education, also for children. It's becoming a good thing now that we are able to also understand the importance of students being vaccinated, the importance of vaccination. WHO has actually produced a tool, electronic game, to teach young students on the importance of vaccination. It's a game, electronic game, and it's being now tested and piloted in a few countries, and hopefully also in Polish it will be available. We had it yesterday during the EIW event. So that's something that can also be beneficial. Let me see if I wanted to say another thing. Yes, I was really impressed by the work that is being carried out with regards to the Ukrainian population here in Poland. But when I looked at Dr. Parodowska's graph of the amount of thousands, actually, of people who are refusing. I mean, there's a statistic also on that, which is also quite impressive to have a statistic on how many people are refusing vaccination. I started wondering, is this the problem with Ukrainian people? It's not, probably. It seems like there's also a very big percentage of that amongst the Polish population. So my question is, what's being done to address the concerns? Why are they refusing the vaccines? We heard the amount, we heard about the number of people, thousands of people refusing, but why? Is it a question of trust? Is it a question of confidence? Is it a question of they're not informed properly? What is the... So we need to look into more closely why, answer those questions. Why are people not distrusting vaccines? Why are they refusing? That's the question, is it? Refusing, right? There could be very many reasons why. And therefore look into that to be able to take the necessary actions.
Thank you very much.
Ja ad vocem ten związek między szczepieniem ochronnym, podaniem szczepienia ochronnego, pewnym rodzajem badaczek i
certain type of epilepsy and neurological disorders can have genetic background.
Jeśli wszystko dobrze się ułoży, prawdopodobnie
If everything
team
goes
Instytutu
well,
Matki i Dziecka
the
będzie starał się badać, które
Institute of Mother
dzieci
and Child team
powinny mieć
will
odroczone
be
szczepienia
able
ze względu właśnie na ryzyko
to
wystąpienia
provide
chorób
tests
neurologicznych po podaniu
into
szczepień.
which
Także
child
tutaj,
should
myślę, że jest
have
duży dla świata
postponed
naukowego,
vaccination in order to
obszar do tego, żeby to badać i żeby,
reduce
żeby tym
such
się zająć. Ale
links.
to tak
This is a
tylko ad vocem.
great
Natomiast jeszcze
area
chcę,
for
na
research.
koniec chcę
This is ad
podzielić
vocem.
czymś, co
In the
usłyszałem
end,
od
I want to share
emerytowanego
with you
profesora
information
medycyny
I heard
portalnej z
from
Londynu.
a retired
Kiedy
professor of
siedzieliśmy,
medicine from
rozmawialiśmy
London.
2 czy 3 tygodnie temu
2 or
na
3
temat
weeks ago, we were together in Brussels. We talked about vaccines. And he said, more or less, when somebody comes to you with a syringe, and when somebody comes to your child with a syringe, you are afraid. Vaccination is not a problem. Refusal is a problem. That's what he said. So when we were to look into the problem, as it has been mentioned by my predecessor, we need to know where to do corrections, because we have a situation that somebody is hesitant, and in the end this person refuses vaccination. We need to explore this space in between hesitation and refusal. And here the Polish language and Ukrainian language should come in. I would start with the research, because we are ahead of another research, and I'd like to appeal for collecting data. Ministry of Health will cooperate with us in this scope, and we will verify it from the healthcare professionals' side, so that we can see how they perceive it, how they perceive refusals, and we also work on how to help professionals to convince mothers in a better way. Here we also have a poll approved by the Institute. Thank you very much for this. And this is the poll concerning artificial intelligence, AI. Healthcare professionals can look for certain solutions in AI. Is AI ready for it? That's the question. Because healthcare professionals are already ready for that.
Thank you again. I wanted just to start from Professor Marcin. He already quoted one of Professor, and it reminded me when I was a student in medical faculty, although that was quite a while ago. And one of the most favorite professor of epidemiology was lecturing, and I was saying that if each of us, after you graduate, you manage to ensure that one child is fully vaccinated and you save life, you finish your mission. So this brings me again to some of the points that I wanted to reinforce, and by hearing our professors and the colleagues, that from UNICEF point of view, we look as a life cycle approach. And it was very impressive to hear Director of Institute of Mother and Child. It's always pleasure and privilege to be in the Institute of Mother and Child, to hear 2 keywords. And one of them was breastfeeding. So as a process of life cycle approach, one the birth start, one the life start, if we convey the love, if we convey the message, or if we want to ensure the healthy start, the first vaccination is breastfeeding. So early initiation of breastfeeding, and we follow up with other evidence-based interventions such as vaccination. So I wanted to use this because there's plenty of wealth of information, evidence, materials. We heard from WHO so many plans which are at our disposal. So we have just to ensure that we practice and we translate that into action. And we have to do this together with parents. They are our partners. So we have to have 2 ways of communication according to their understanding, to their needs, what are the fears. So we address, we mitigate that. And the health workers have the key role on this. The decision makers, policy makers, they can support, but health workers are the conveyors, and they are in the front lines when they are facing on daily basis parents. They are dealing with different challenges, so we have to support them, to also understand them, which will contribute to that building and maintaining trust. Once the trust is established, the process is even easier. But we have not to take it granted, because sometimes we put a lot of efforts to reach the 95%. And then we take it granted and we leave it after 2. Then we realize that again we are declining. So it's a systematic, consistent process of promoting, but also protecting vaccination. We have to protect vaccination, not only to promote, to protect, to have a partnership with parents to make this process successful, continuous, for the benefit children, but also for all society. If the child gets sick, and sometimes we, for example, even on daily basis, we hear parents that I take sick leave. Why? Because the child is sick. So a child missed from the education, it missed from the preschool, it cannot learn, it might be disabled. So there are all these messages that we have to see or to translate, not only from health point of view, but also from financially, economically, and burden to the health system. Because every cost, it brings burden to the Ministry of Health, to the system. So prevention, protection, they make better results for everyone. Thank you.
To na koniec jeszcze bym poprosiła panią doktor.
In the end, I'd like to give the microphone to the doctor, and I'd like to ask you for 2 words at the end to tell us what can we do, because today we've heard many ideas, and according to you, which are the most valuable? What can we do?
Nie chciałabym się powtarzać, bo
I wouldn't like to repeat so many information, so much information, all this advice and suggestions are very valuable. It concerns education and development, but the most important message would be to trust vaccination. Thank you very much. Thank you for your participation here in this discussion. I am full of hope after this discussion. I know that we do have a problem, but this problem is noticed and we are looking for solutions. Thank you very much. Thank you, and the message goes global. Thank you very much. Thank you and goodbye. Thank you for your attention.
Fundacja Instytutu Matki i Dziecka od 10 lat promuje zdrowie, promuje profilaktykę chorób zakaźnych, w tym również szczepienia rutynowe. Dzisiaj była to impreza na wesoło, rodzinna, w dniu jutrzejszym wykłady, rozmowy naukowców, debaty, więc dalej w ramach Międzynarodowego Tygodnia Szczepień będziemy rozmawiać o zdrowiu i o tym, jak najskuteczniej przeciwdziałać chorobom zakaźnym właśnie poprzez szczepienia.
So it's so exciting to be at this great event here today, bringing together children and families from Poland, from Ukraine, a chance to socialize, a chance to exercise, a chance to run, and all in the service of a great cause, which is trust in vaccination.
Gdzie można się dowiedzieć wszystkich potrzebnych informacji. Pamiętajcie Państwo, że szczepienia to jest największe osiągnięcie XX wieku. Dzięki niemu przestały umierać niemowlęta.
Z całego serca dziękuję, że przyszliście, że chcieliście wziąć udział w pikniku rodzinnym pod hasłem Zaufaj szczepieniom, bo to znaczy zaufaj medycynie opartej na dowodach.
Temat szczepień niezwykle ważnym i niestety w ostatnich latach obserwuje się taka tendencja, że w Polsce ten poziom wyszczepialności trochę się obniża i z tego powodu obawiamy się, że może dojść do tego, że poszczególne choroby, których tradycyjnie tutaj nie było wiele albo nie było wcale, jednak się pojawią. I z tego powodu chcemy poinformować społeczność, poinformować rodziny, dzieci, że szczepienia są niezwykle ważne, że to jest efektywna, skuteczna metoda zapobiegania chorobom zakaźnym.